So hi students, hello, just one moment. So hello to all of you. Let us start. So hello bachcho, and a special edition of PYQs for the upcoming INICT. I hope this will help you to prepare and help you to get an insight of the subject of anatomy. ठीक है? इसके पहले the grand test that we have, the grand test. ठीक है? So real time exam simulation, you can predict your scores and your weak areas can be identified. You can increase your accuracy. So we have started with grand test. जरूर देना ये grand test. ठीक है? Okay, we'll start now. Let us begin. So starting with the first MCQ. ये first MCQ देख लो. This is fine. Just one moment. Okay. So have a look. A hyperabduction injury. Hyperabduction injuries. ये क्या होता है? Hyperabduction is मतलब see before seeing this options पहले stem पढ़ लो अच्छे से. Read the stem of the MCQ properly. एक conclusion को arrive करो and then you see the options. So पहले options नहीं देखना है. Okay. So hyperabduction injury. What is this hyperabduction injury? जोर से abduction होता है. A hyperabduction. When there's a hyperabduction, तो इसमें क्या होता है ना, ये जो लोअर ट्रंक ऑफ ब्रेकियल प्लेक्सस है दैट इज इंज्यूर्ड. लोअर ट्रंक ऑफ ब्रेकियल प्लेक्सस इंजरी होती है इन हाइपर एब्डक्शन. लाइक अ पर्सन इज फॉलिंग डाउन. हाँ, एक बंदा पेड़ पे चढ़ा है, हिज क्लाइम्ड अ ट्री एंड ही फॉल्स डाउन. अब जब वो नीचे गिरता है, सो ही होल्ड्स अ ट्री, ही होल्ड्स अ बार्क and then he gets a jerk. These are hyperabduction injury. इसमें क्या होता है, द लोअर ट्रंक ऑफ द ब्रेकियल प्लेक्सस इन्वॉल्व्ड. हाँ, लोअर ट्रंक की इंजरी होती है. It leads to Klumpke's paralysis. So lower trunk injury से क्या होता है? Klumpke's paralysis होता है. Fine. Upper trunk injury से क्या होता है? Erb's paralysis होता है. So what is the characteristic clinical finding seen in this lesion? Yes, anyone? So Klumpke's paralysis है, fine है. So what do you get in this Klumpke's paralysis out of all this? So policeman stiff hand कहाँ पे मिलता है? Policeman stiff hand मिलता है Erb's paralysis में. So this is out. So policeman stiff hand कहाँ पे मिलता है? Erb's paralysis. Erb's paralysis में policeman stiff hand. Claw hand. So Klumpke's paralysis में which part of the brachial plexus is involved? Lower trunk. Lower trunk involvement है. Lower trunk is C8 and T1. C8 and T1. And this C8 and T1 mainly supplies small muscles of the hand. ये छोटे छोटे muscles को supply करता है. We get a claw hand. Right? So Klumpke's paralysis में क्या मिलता है? Claw hand. So answer for this is claw hand. Claw hand. ठीक है ना? Claw hand. Wrist drop. Tell me, when do we get a wrist drop? Wrist drop. Which is the nerve which causes extension at, which is the muscle which causes extension at the wrist? बोल सकते हो? वो कौन सा muscle है जो extension करता है wrist को? Hi. Very good. Which is the muscle which does extension at the wrist? बोल सकते हो? That's ECRL. हाँ, ये ECRL muscle है which does extension at the wrist. And this ECRL muscle is supplied by which nerve? Guess करो बच्चों. Come on, can you answer this? हाँ, it is supplied by radial nerve. Very good. Abhishek, yes, Abhishek Patil, very good. Paras, very good. So this is supplied by radial nerve. So radial nerve की जब injury होती है, ECRL is paralyzed, so you get a wrist drop. Finger drop कब होता है? Can anyone tell me when do we get a finger drop? Extension of fingers, ये कौन करता है? Extension of fingers is done by extensor digitorum. What is the nerve which supplies the extensor digitorum? Come on, answer this. What is the nerve which supplies the extensor digitorum? Yes, Abhishek. Yes, Paris. The nerve which supplies the extensor digitorum is radial nerve नहीं. It's the posterior interosseous nerve. So जब posterior interosseous nerve का lesion होता है, we get a finger drop. Okay, we get a finger drop. So finger drop is due to pin, posterior interosseous nerve lesion. ये याद रखना. And regimen batch sign. What is regimen batch sign? Regimen batch sign is loss of sensations of the skin on the upper lateral aspect of the arm. Loss of sensations of the skin on the upper lateral aspect of the arm, which is the nerve involved. Come on, बोल सकते हो, which is the nerve involved? Yes, very good, very good. Excellent, बहुत अच्छा आंसर कर रहे हो. So which nerve when involved leads to a regimen batch sign? बहुत important है. ये सारे MCQs important है. This itself can come as a clinical question. हाँ, come on, axillary nerve, very nice, axillary nerve. So regimen batch sign कब मिलता है आपको? Axillary nerve injuries में. वैसे axillary nerve दो muscles supply करती है. Axillary nerve supplies two muscles. One is deltoid, the second one is teres minor. Yes, the deltoid and the teres minor, and it continues as the upper, it gives a branch, upper lateral cutaneous nerve arm. Upper lateral cutaneous nerve arm injury to this leads to a regimen batch sign. Excellent, very good. I hope this is clear to all of you. ऐसे उसको analyze करिए. First read the stem of the MCQ properly. Stem पढ़ते पढ़ते you will come to some conclusion, some answer. फिर उसके बाद options देखना है आपको. Fine. I hope this is clear. Coming to the next MCQ. Yes. Root value of the pointed structure. चलो बच्चों बोल सकते हो. What is this pointed structure बोल सकते हो? हाँ. उसके पहले what is this A muscle? ये A muscle कौन है बोल सकते हैं? What is this A? This A is going to divide. Okay, ये A जाने दो. Just tell me what is that pointed structure? This is the lateral cord. ये है lateral cord of the brachial plexus. That's the medial cord of the brachial plexus. This is the medial nerve. ये है medial nerve. So what is this structure? This is a nerve. Any guesses? This is the nerve which is piercing a muscle. ये muscle है Coracobrachialis. ये muscle Coracobrachialis है. So which is the nerve which pierces the Coracobrachialis? Come on, that's the MCQ. Nerve piercing the Coracobrachialis. It's a branch of lateral cord. अब बोलो. तो ये lateral cord है, उसकी branch है. It's a branch of lateral cord which is piercing the Coracobrachialis. Yes. वैसे lateral cord के तीन branches हैं. Lateral pectoral, lateral root of median nerve, and तीसरा है musculocutaneous nerve. Musculocutaneous. So this is the musculocutaneous nerve. ये है अपनी musculocutaneous nerve. And why is it musculocutaneous nerve? Because it is piercing. It is piercing Coracobrachialis. वो Coracobrachialis को pierce कर रही है. That is why it is the musculocutaneous nerve. Yes, उसका root value होगा C5, C6, C7. Yes, C5, C6, C7. That's the lateral cord. Lateral cord की root value है C5, C6, C7. Okay. C5, C6. Which I mean C5, C6 is what? Upper trunk. Upper trunk है ना. C5, C6 is upper trunk. C5, C6 axillary nerve भी होता है. Fine. Which is the nerve which has a root value of C7, C8 and T1. ये कौन सी nerve है? बोल सकते हो? C8, T1 is lower trunk of brachial plexus. C5, C6 is upper trunk of brachial plexus. C5 to T1 is the posterior cord. Radial nerve होता है वो कौन सी nerve है जिसका root value है C7, C8 and T1? Come on, answer this. Which is the nerve? C7, C8 and T1. I'm looking at the screen. You answer. हाँ बोलो. वो कौन सी nerve है जिसका root value है C7, C8 and T1? Remember, ये बहुत important है. This is ulnar nerve. Ulnar nerve. Ulnar nerve is a branch of medial cord. तो but ulnar nerve की root value है C7, C8, T1. ये C7 के fibers आते हैं lateral cord से. The C7 fibers come from the lateral cord. याद रखना. Fine. So ये ऐसे visuals आते हैं. Visuals बहुत important है INICET के लिए. So ये याद रखना. That's the lateral cord. This is the axillary artery. That's the axillary vein. This is the lateral cord, medial cord. That's the lateral root of medial nerve. This is the musculocutaneous nerve. That's the medial root of medial nerve. And this is the median nerve. Medial nerve. Perfect. Okay, perfect. Fine. Any doubts? Fine. I'll proceed. Okay. Chalo. A patient presented with inability to flex the distal interphalangeal joints of 4th and 5th digits. A person presented with inability to flex the distal interphalangeal joints. ये वाले हैं distal interphalangeal joints. अब पहले ये एनालाइज करो, ये डिस्टल इंटरफैलेंजियल जॉइंट्स को कौन फ्लेक्स करता है? Which is the muscle which is going to flex the distal interphalangeal joints of fourth and fifth digits? Answer this. Answer this. Which is the muscle which flexes the distal interphalangeal joints of fourth and fifth digits? It's the flexor digitorum profundus. Flexor digitorum profundus वो muscle है जो distal phalanges को flex करता है. Proximal phalanges को कौन flex करता है? Flexor digitorum superficialis. But specifically distal phalanges who's going to flex? The flexor digitorum profundus. Okay, so ये muscle है flexor digitorum profundus. Now what is the nerve supply of flexor digitorum profundus? Flexor digitorum profundus is medial half, medial half, lateral half. The medial half is supplied by which nerve? Ulnar nerve, and the lateral half is supplied by the anterior interosseous nerve. Anterior interosseous nerve. So distal interphalangeal joints को कौन flex करेगा? Flexor digitorum profundus. हाँ, उसका medial half is supplied by ulnar nerve, the lateral half is supplied by the anterior interosseous nerve. So fourth and fifth digits है ना, so it would be the ulnar nerve. हाँ, ulnar nerve होगा medial half. So ulnar nerve involvement है. Patient is also unable to hold a piece of paper between the fingers. Piece of paper, what is this? Adduction of fingers. अगर आप paper को hold करते हो, what is that? Adduction of fingers. This is done by adductor pollicis. The nerve is ulnar nerve. So where is the ulnar nerve related to this bone? Behind the medial epicondyle. So ये है medial epicondyle. D is the medial epicondyle. Ulnar nerve medial epicondyle के पीछे जाती है. So injury to the ulnar nerve leads to paralysis of flexor digitorum profundus, paralysis of the palmar interossei. Adduction of fingers कौन करता है? Palmar interossei. Right. So answer is ulnar nerve. Ulnar nerve कहाँ पे होती है? It's behind the medial epicondyle of the humerus. समझ में आ रहा है? Person is also unable to hold a piece of paper between the fingers. At which of the following marked site the nerve is most likely to be involved? So इसका आंसर क्या होगा? D. समझ में आ रहा है बच्चों? Are you able to follow this? Yes, answer this. Are you able to follow this? Yes. Yes, Abhishek Patil. Is this clear? Where is Paras? Paras Bansal. समझ में आ रहा है? कुछ doubts हैं? If you have any doubts, you ask me. Fine. I hope this is clear. I'll proceed. Okay, fine. So that's the third MCQ. Now coming to the next MCQ, the fourth one. Okay. Posterior interosseous nerve injury leads to one of the following. बच्चों बोलो, posterior interosseous nerve is a branch of what? Posterior interosseous nerve is a branch of which nerve? It's a branch of radial nerve. Branch of radial nerve. Posterior interosseous nerve is a branch of radial nerve. So इसका आंसर क्या होगा? हाँ, loss of extension of digits. बराबर है? Extension of digits is done by extensor digitorum, and this extensor digitorum is supplied by posterior interosseous nerve. This is supplied by posterior interosseous nerve. Wrist drop, the muscle which does extension at the wrist is extensor carpi radialis longus, and this is supplied by the radial nerve. ये radial nerve supply करती है. So extension at the wrist joint is done by ECRL, and ECRL को कौन supply करता है? Radial nerve. Extension of digits is done by extensor digitorum, and this extensor digitorum is supplied by the posterior interosseous nerve. Yes, Ramashish, very good. So answer is this. Loss of supination. Can anyone tell me who does supination? Supination कौन करता है? Which are the muscles causing supination? Come on बच्चों, be interactive so it will be easy for you. Supination of the forearm, ये कौन करता है? Supination is done by two muscles. दो muscles होता है जो supination करते हैं. एक है biceps, B-I-C-E-P-S, biceps brachii, and दूसरा है supinator. Biceps brachii and supinator. ठीक है? दो muscles है जो supination करते हैं. One is biceps brachii, the second is supinator. What is the nerve supply of biceps brachii? Biceps brachii is supplied by the musculocutaneous nerve, and supinator is supplied by the posterior interosseous nerve. Posterior interosseous nerve. Right. सो अगर पोस्टीरियर इंटरॉक्शनस नर्व डैमेज होती है सो सुपाइनेशन इज इंटैक्ट, सुपाइनेशन पूरा लॉस्ट नहीं होगा. व्हाई? बिकॉज बाइसेप्स ब्रेकाई इंटैक्ट है, बाइसेप्स इज सप्लाइड बाय मस्कुलोक्यूटेनियस नर्व, सो लॉस ऑफ सुपाइनेशन विल नॉट बी देयर कंप्लीटली. थोड़ा सा लॉस होगा. लॉस ऑफ एक्सटेंशन ऑफ रिस्ट, दिस इज डन बाय ECRL, ECRL, and who supplies this? The radial nerve. ECRL को कौन सप्लाई करता है? Radial nerve. Fine. Is this clear? बच्चों समझ में आ रही है? So posterior interosseous nerve injury leads to one of the following. Fine. So answer is loss of extension of the digits. Loss of extension of digits. Fine. Very good. Very good. Very good. You're answering well. Be interactive. जितना interactive रहोगे ना उतना अच्छा होगा आपके लिए. It will be easy for you also. Now look at this. A patient presented with history of chop injury to the right hand is undergoing surgical repairs. It is observed that the patient is unable to completely fold the ring finger while making the fist, as shown in the diagram. Which structure injury results in this inability? बोल सकते हो the person is not able to flex the, unable to completely fold the ring finger को fold नहीं कर पा रहा है. So with what is the answer for this? Easy है. What is the answer for this? So which is the muscle which causes flexion at the digits? Flexion of the digits is done by flexor digitorum superficialis and flexor digitorum profundus. दो muscles है, तो flexor digitorum superficialis and profundus है, which causes flexion of the digits. So answer here is going to be the flexor digitorum profundus. Flexor digitorum profundus. Flexor pollicis longus will cause flexion of the thumb. ये thumb का flexion करेंगे. Flexor pollicis longus will cause flexion of the thumb. Flexor digitorum profundus will cause flexion of the digits. क्या लिखा है? Medial nerve. Completely fold the ring finger. Yes. Ramashish. Flexor retinaculum तो है ही नहीं, flexor retinaculum नहीं आएगा. देखो उन्होंने है ना what they have given ring finger specifically दिया है. If they would have written flexion of the fingers, अगर दो तीन fingers involved है तो then the answer would be medial nerve. एक सिंगल फिंगर लिखा है ना, रिंग फिंगर लिखा है, सिंगल फिंगर लिखा है, ओनली रिंग फिंगर कैन नॉट बी फ्लेक्स्ड. द आंसर हियर इज फ्लेक्सर डिजिटम प्रोफंडस. ठीक है, क्लियर है? हाँ, द आंसर वुड बी प्रोफंडस फॉर दिस. मीडियल नर्व भी बराबर है, बट मीडियल नर्व अगर इंजरी होती है तो एक सिंगल मसल इंजर नहीं होगा ना, है ना. देयर विल बी मेनी फिंगर्स व्हिच विल बी इन्वॉल्व्ड. फ्लेक्सर डिजिटम सुपरफिशियलिस पूरा मीडियल नर्व सप्लाई करता है. प्रोफंडस third and fourth, I mean the ring finger and little finger is supplied by flexor digitorum profundus, is flexed by flexor digitorum profundus, which is supplied by ulnar nerve. So answer here is flexor digitorum profundus. Fine. Okay, see the next. Which of the following nerve supplies the highlighted muscle? चलो बच्चों बोलो, ये highlighted muscle कौन है? What is this highlighted muscle? ये सब PYQs है. Which have been asked in the last year's INICET. Okay, very good. चलो बोलो, what is this highlighted muscle? ये वो muscle है which begins from the vertebral column and gets inserted on the scapula, the medial border of the scapula, from the superior angle to the spine. Superior angle to the spine. What is this muscle? ये है अपना levator scapulae. That's the levator scapulae. Fine है. Now tell me, what is the nerve supply of this? Scalenus नहीं है बच्चे, ये scalenus नहीं है. Scalenus anterior is inserted on the first rib. See, scalenus anterior आप बोल रहे हो. So this is the first rib. ये first rib है, यहाँ पे scalene tubercle है. These are the cervical vertebrae. ये cervical vertebrae है. If this is scalenus anterior, the scalenus anterior would begin from the cervical vertebrae. It will get inserted on the scalene tubercle of the first rib. ऐसे आंसर करो बच्चों. You answer तो गलती होती है ना, तो I can correct you. ठीक है ना? So scalenus anterior is inserted on the scalene tubercle of the first rib, and there's a nerve lying on the scalenus anterior. चलो बच्चों अभी आपने scalenus anterior बोल ही दिया है तो tell me the nerve which lies on the scalenus anterior. Any guesses? Nerve lying on the scalenus anterior is, come on, answer. I'm looking at the screen. Answer. Nerve lying on the scalenus anterior. Very, very, very important MCQ. Nerve lying on the scalenus anterior जिसका रूट वैल्यू है C345. कौन है ये? C3, C4, C5. दिख नहीं रहा है ये? So nerve lying on the scalenus anterior जिसका रूट वैल्यू है C3, C4, C5. Who's that? Phrenic nerve. Excellent. Very good. Very good. तो बच्चों क्लियर है ये scalenus anterior नहीं है. This is not scalenus anterior because this muscle begins from the vertebral column and it gets inserted on the scapula, dorsal aspect of the scapula. ये scapula को elevate करेगा. That's the levator scapulae. Levator scapulae. So that's levator scapulae. यहाँ पे होता है rhomboides minor, and the muscle here is the rhomboides major. Levator scapulae, rhomboides minor, rhomboides major. All these muscles are supplied by what? Any guesses? Levator scapulae, rhomboides minor, rhomboides major का nerve supply क्या है? Come on, can you guess this? I'm looking, I'm waiting. Come on. Answer करिए. इसका nerve supply है dorsal scapular nerve. Dorsal scapular nerve or the nerve to rhomboids. Nerve to rhomboids जिसकी root value है C5 है ना. C5 root से आती है. C5 root of the brachial plexus से आती है. Dorsal scapular nerve. Very good बच्चे, बहुत अच्छा आंसर कर रहे हो. Very nice. सानिया, yes. Yes, Ramashish, very good. Medico, very good. Clear? So levator scapulae, rhomboides minor, rhomboides major is supplied by dorsal scapular nerve जो C5 root of the brachial plexus से निकलती है. C5 root of the brachial plexus. Clear to all of you? Yes. Perfect. चलो, suprascapular nerve arises from the upper trunk of the brachial plexus. याद है suprascapular nerve कहाँ से arise होती है? Upper trunk of the brachial plexus. Suprascapular nerve क्या supply करती है? Supraspinatus, infraspinatus. So suprascapular nerve supplies the supraspinatus and infraspinatus. Subscapular nerve supplies the subscapularis. Subscapular nerve दो होते हैं ना? Subscapular supplies the subscapularis. Dorsal ramus of C1 is not that important. Fine, clear to all of you? Dorsal ramus of C1 को बोलता है suboccipital. Fine, okay. So we go to the next MCQ, number 7. Identify the pointed structure. चलो बच्चों identify कर सकते हो. ये pointed structure को identify करना बहुत important slide है ये. This is a very important visual slide for you. And जब visual slide आएगा ना, I'll tell you, we'll try to see as many things as possible. ठीक है? चलो, answer this. What is this nerve? तो ये posterior triangle of neck है. In this posterior triangle of the neck, यहाँ पे एक plexus होता है जिसका नाम है cervical plexus. ठीक है? So tell me, what is this A? What is this A? What is this B? What is this C? And what is this D? Pointed structure. A supplies the skin over the occiput. A है lesser occipital. तो ये lesser occipital is A. B है greater auricular nerve. Greater auricular nerve is this B. And this greater auricular nerve supplies the skin over the angle of the mandible. This you know. So greater auricular nerve वो nerve है जो skin over the angle of mandible को supply करती है. When there's a lesion of the skin over the parotid gland, there's a mixing of the fibers of auriculotemporal nerve and greater auricular nerve. When a person salivates, जब ये बंदा salivate करता है, he gets sweating of the skin over the parotid gland. नाम बताओ. What is this condition known as? Come on, students. When there's a lesion of the skin over the parotid gland, mixing हो जाते हैं fibers के, the greater auricular nerve mixes with the auriculotemporal nerve. Now when this person salivates, he gets sweating of the skin over the parotid gland, and this is what we call as, come on, complete that. I'm waiting, miss. देख रहा हूँ slide के पास. I'm looking at the screen. Come on, बच्चों, answer this. Fraze syndrome. Very nice. That is Fraze syndrome. Excellent. उसे हम बोलते हैं फ्रेस सिंड्रोम, करेक्ट। सो दैट्स अ ग्रेट ऑरिकुलर नर्व। ये जो ग्रेट ऑरिकुलर नर्व है ये पिन्ना को भी सप्लाई करती है, लोअर 1/3 ऑफ द पिन्ना ऑन द लैटरल साइड एंड द मीडियल साइड, ये पिन्ना को भी सप्लाई करती है। This part of the pinna, upper 2/3 of the pinna on the lateral side is supplied by auriculotemporal nerve. यहाँ पे auriculotemporal, पीछे है great lesser occipital nerve. So वो nerve supply of pinna भी हो जाता है. Fine. So that's great auricular. C is transverse cervical cutaneous. वो जो C लिखा है ना वो है transverse cervical cutaneous, and D is supraclavicular nerve. Supraclavicular nerve, that's D. Supraclavicular nerve is D. So ये जो pointed structure है वो supraclavicular nerve है. It supplies the skin above the clavicle. ठीक है? Can anyone tell me what is this? चलो ये बोलो, ये कौन है? What is this structure? ये इंपॉर्टेंट है. व्हाट इज दिस ई? ये जो ई जो नर्व है ना, दिस ई नर्व इज गोइंग टू पियर्स द बक्सिनेटर. ये बक्सिनेटर को पियर्स करती है. इट सप्लाइज द स्किन ओवर द बक्सिनेटर. नेम दिस नर्व जिसे हमने ई लेबल किया है. इट पियर्सेस द बक्सिनेटर एंड इट सप्लाइज द स्किन ओवर द बक्सिनेटर. नाम बताओ. These are all very important visual slides, बच्चों. याद रखना, these are the visual slides. Any guesses? Any guesses? नहीं. बहुत इंपॉर्टेंट है. स्ट्रक्चर्स पियर्सिंग द बक्सिनेटर. स्ट्रक्चर्स पियर्सिंग द बक्सिनेटर, वन इज द पैरोटिड डक्ट. एक तो पैरोटिड डक्ट है. सेकंड इज द डक्ट ऑफ मोलर ग्लैंड्स. जो मोलर ग्लैंड्स है उनके डक्ट बक्सिनेटर को पियर्स करते हैं. एंड द थर्ड वन इज द बक्कल ब्रांच ऑफ मैंडिबुलर नर्व. इट्स द बक्कल ब्रांच ऑफ मैंडिबुलर नर्व. लिंगुअल नहीं है बच्चे. लिंगुअल बाहर नहीं आता है. लिंगुअल नर्व डजंट कम आउट. ये बाहर आ रही है. देखो ना, दिस इज कमिंग आउटसाइड. इट इज कमिंग टू सप्लाई द स्किन. मतलब ये क्यूटेनियस नर्व है. इट इज द बक्कल ब्रांच ऑफ मैंडिबुलर नर्व. इट्स द बक्कल ब्रांच ऑफ मैंडिबुलर नर्व. याद रखना. वैसे बक्कल ब्रांच ऑफ फेशियल नर्व भी होता है, राइट? बक्कल ब्रांच ऑफ फेशियल नर्व भी है, बक्कल ब्रांच ऑफ मैंडिबुलर नर्व भी है. व्हाट इज द डिफरेंस? द फेशियल नर्व का बक्कल ब्रांच जो है दैट इज मोटर, एंड मैंडिबुलर नर्व का बक्कल ब्रांच इज सेंसरी. दिस बक्कल ब्रांच ऑफ मैंडिबुलर नर्व pierces the buccinator, comes out and supplies the skin over the buccinator. Very important. So structures piercing the buccinator, ये एक MCQ आता है. One is parotid duct. ये तो अपने को पता है. Parotid duct, yes, pierces the buccinator. Second is ducts of molar glands. And third is the buccal branch of mandibular nerve. Just take it from me. Buccal branch of mandibular nerve. बहुत important है बच्चों. याद रखना. Note this down. Very important for you. Fine. Perfect है. Enjoying. Okay, ये मैं बोल रहा था आपको. हाँ, अभी ये कैसे ड्रॉ करूँ? चलो, ये ना, ये ऐसे ड्रॉ करता हूँ. मतलब ये पिन्ना मैंने ड्रॉ किया. पिन्ना बच्चे, दिस इज द लैटरल साइड एंड दिस इज द मीडियल साइड. हाँ, लैटरल साइड एंड मीडियल साइड. लैटरल साइड पे ये दिखेगा, मीडियल साइड से ये नहीं दिखेगा. ओके, सो दैट्स अ मीडियल साइड ऑफ पिन्ना. मतलब ये लैटरल साइड ये है, मीडियल साइड ये है. सो अब बोलो, हु इज गोइंग टू सप्लाई द स्किन हियर on the medial 2/3? This is the auriculotemporal nerve. Auriculotemporal nerve. And ये स्किन को कौन सप्लाई करेगा? लेसर ऑक्सीपिटल नर्व. लेसर ऑक्सीपिटल नर्व. दिख रहा है? नहीं दिख रहा? ओके, दिस इज द auriculotemporal nerve and this is the lesser occipital nerve. Lesser occipital nerve. And who supplies the skin here? Below here. This is the greater auricular nerve. Greater auricular nerve. So greater auricular nerve supplies the skin over the lower part of the pinna. Lower 1/3. Lateral side, medial side. दोनों sides पे कौन है? Greater auricular. ऊपर की तरफ कौन है? Auriculotemporal. ये देखो ना, this is auriculotemporal nerve. So auriculotemporal nerve ये side का supply करेगा, and ये side का supply कौन करेगा? Lesser occipital. Fine. That's the nerve supply of pinna. ये याद रखना. And who's going to supply this? This one. ये ना, ये external acoustic meatus. This is supplied by vagus. External acoustic meatus को कौन supply करती है? Vagus nerve. Fine. Perfect है. Okay, so this is what is important for you. Chalo, we'll go to the next MCQ. Fine. Okay. Yes, identify the pointed structure. चलो बच्चों, identify this pointed structure. Any guesses? Guess कर लो. Arnold's nerve, auricular branch of vagus. Very good, Sania. Excellent. Auricular branch of vagus is known as Arnold's nerve. Perfect. Tell me, what is tympanic branch of glossopharyngeal nerve known as? Tympanic branch of glossopharyngeal nerve. Any guesses? सानिया, आपने आंसर किया ऑरिकुलर ब्रांच ऑफ वेगस. वेरी गुड. वो आर्नोल्ड्स नर्व है, दैट्स ऑरिकुलर ब्रांच ऑफ वेगस. उसका दूसरा नाम है एल्डरमैन्स नर्व. आर्नोल्ड्स नर्व, एल्डरमैन्स नर्व सेम है. वैसे टिम्पैनिक ब्रांच ऑफ ग्लॉसोफैरिंजियल नर्व इज नोन एज व्हाट? एनी गेसेस? हाँ, वेरी गुड. यस रामाशीष, राइट है. जस्ट टेल मी, व्हाट इज द टिम्पैनिक ब्रांच ऑफ ग्लॉसोफैरिंजियल नर्व नोन एज? Jacobson's nerve. याद रखना, ये Jacobson's nerve याद रखना. Jacobson's nerve. Very good. So tympanic branch of glossopharyngeal nerve को हम बोलते हैं Jacobson's nerve. The auricular branch of vagus को हम बोलते हैं Arnold's nerve और Alderman's nerve. Alderman's nerve. Excellent. Very good. So what is the answer for this? हाँ, एक मिनट. ये कौन है? That's a sympathetic plexus. That's a sympathetic chain. हाँ, to be specific, that's a sympathetic chain. अब ये देख रहे हो, what is this? Carotid sheath. This is a carotid sheath, है ना? Carotid sheath. ये वेगस देख रहे हो, that's a वेगस. Just tell me, what is this fascia? ये नंबर A कौन है? That what is this fascia? What is this fascia? B. और तीसरा कहाँ गया? तीसरा is this. What is this? C. ये तीन fascias को identify करिए. These are the deep fascias of the neck. These are the deep fascias of the neck. The one which covers the thyroid gland, that's the pretracheal fascia. बराबर है? The pretracheal fascia covers the thyroid gland. One which is going to enclose the neck, that's the investing layer of deep cervical fascia. So जो A लिखा है ना, that's the investing layer of deep cervical fascia. B is the pretracheal fascia. Pretracheal fascia. And what is C? C is the prevertebral fascia. Prevertebral fascia. C is the prevertebral fascia. याद रखिए, just remember these fascias. I hope you can see this properly. So that these are the various fascias of the neck. Deep fascias of the neck है ये. Investing pretracheal, prevertebral fascias. Perfect है. अब ये देखो, can you see this? एक ये देखो, who's this? That's a trachea. That's a esophagus. What is this structure? ये structure कौन है? This one. What is this structure? That's a nerve. Trachea and esophagus के बीच में एक nerve होती है. Just tell me the name of the nerve. You know this. I'm just asking you. Between the trachea and the esophagus, what is the nerve? Very good. Recurrent laryngeal nerve. Excellent. Yes. That's a recurrent laryngeal nerve. Right. Very nice. Perfect है बच्चों. Perfect है. चलो, तो what is the answer for this? इसका आंसर क्या है? Sympathetic chain. इसका आंसर है sympathetic chain. Vagus nerve is in the carotid sheath. Phrenic nerve दिख रहा है क्या यहाँ पे? Can you see the phrenic nerve here? इसमें phrenic nerve देख सकते हो? Look, ये है ना, these are the prevertebral muscles. ये this is the prevertebral fascia. ये देख रहे हो, that's a prevertebral fascia. So these are the prevertebral muscles. इसमें this muscle is the scalenus anterior. ये जो मैं मार्क कर रहा हूँ ना, that's the scalenus anterior. And scalenus anterior के ऊपर you can see this nerve here. The nerve which lies on the scalenus anterior, that is the phrenic nerve. याद रखना. So nerve जो scalenus anterior के ऊपर है, that's the phrenic nerve. देख सकते हो? So ये है prevertebral muscles. Prevertebral muscles में एक होता है scalenus anterior. ये है अपना scalenus anterior. And this is the phrenic nerve. ये scalenus anterior है, ये scalenus medius है, ये yellow है, that's a brachial plexus. ये brachial plexus आता है. Fine? Okay, that's fine. See this MCQ. Identify the mark structure. बच्चों बहुत इंपॉर्टेंट है. टेक दिस फ्रॉम मी. व्हाट इज दिस? कहां पे है हम? कैन यू टेल मी व्हाट इज दिस एरिया? ये एरिया का नाम बताओ. चलो, व्हाट इज दिस एरिया? वेयर आर वी? just now you tell me. अब वो क्लियर दिखेगा, नहीं तो आई कम इन बिटवीन, है ना? ये एरिया क्या है? हमने मैंडिबल को कट किया, वी कट द मैंडिबल, हमने मैंडिबल को निकाल दिया. दिस एरिया इज लाइंग डीप टू द मैंडिबल. व्हाट इज दिस एरिया नोन एज? कम ऑन, आंसर दैट. ये एरिया का नाम बताओ. एरिया का नाम बताओ. हाँ, क्या लिखा है? इंफ्राटेम्पोरल फोसा. वेरी नाइस बच्चे, वेरी गुड, बहुत बढ़िया. सो दिस इज द इंफ्राटेम्पोरल फोसा. बच्चे, इंफ्राटेम्पोरल फोसा क्या है? दिस इज द टेम्पोरल फोसा. दिस इज द बॉडी ऑफ द मैंडिबल. दैट्स द रेमस ऑफ द मैंडिबल. रेमस को हमने निकाल दिया. वी रिमूव द रेमस एंड दैट इज द इंफ्राटेम्पोरल फोसा. करेक्ट. In this infratemporal fossa, I can see two muscles. Can anyone tell me what is this A muscle and what is this B muscle? Chalo, answer that. What is that A muscle? A is the lateral pterygoid. A kaun hai? Lateral pterygoid. B is the medial pterygoid. B is the medial pterygoid. Fine. What is that pointed structure? Chalo, bol sakte ho. What is that pointed structure? एक्सीलेंट, बहुत बढ़िया, बहुत अच्छा आंसर कर रहे हो बच्चों. कम ऑन, कीप इट अप, कम ऑन. दिस इज द इंफ्राटेम्पोरल फोसा. तो मैं क्या पूछ रहा हूं आपको? आई एम आस्किंग यू द कंटेंट्स ऑफ इंफ्राटेम्पोरल फोसा. यस, द कंटेंट्स ऑफ इंफ्राटेम्पोरल फोसा. एक तो लैटरल टेरिगॉइड है, एक मीडियल टेरिगॉइड मसल्स है. फाइन. देयर इज एन आर्टरी इन द इंफ्राटेम्पोरल फोसा. एक आर्टरी होती है which is divided into 3 parts by the lateral pterygoid. Lateral pterygoid ये आर्टरी को 3 parts में डिवाइड करता है. The same artery which gives 15 branches, 15 branches देते हैं ये आर्टरी. What is this artery? It's a terminal branch of external carotid. It's a terminal branch of external carotid. Come on, external carotid artery enters the parotid gland. ये parotid gland के अंदर जाती है. Parotid gland में external carotid gives 2 branches, 2 terminal branches. ये external carotid है. This gives 2 terminal branches. बोल सकते हो? What is this? Superficial temporal artery, and this is the maxillary artery. यह है अपनी maxillary artery, and this maxillary artery enters the infratemporal fossa. The same maxillary artery is divided into 3 parts by the lateral pterygoid muscle. याद रखना, very important. अब उसके branches देख लो. 15 branches देती है, 15 branches. चलो एक बोल देता हूँ. MCQ आया था. Pharyngeal artery is a branch of. MCQ आया था. Pharyngeal artery is a branch of. अब बच्चों ने लिखा external carotid. क्या बोलते हो? What do you say? What is your take? Pharyngeal artery is a branch of. Students ने लिखा external carotid. गलत है, वो गलत है. Pharyngeal artery is a branch of maxillary artery. Pharyngeal artery is a branch of maxillary artery, which is a branch of external carotid. Ascending pharyngeal. Yes, ascending pharyngeal artery होती है branch of external carotid. Pharyngeal artery is a branch of maxillary artery. समझ में आ रहा है? Okay, fine. So just see the branches of maxillary artery. 15 branches है maxillary artery की. If you can remember that, that's fine. So ये है maxillary artery. Perfect. Okay. Now you tell me what is this C? ये C कौन है और ये D कौन है? ये nerves है. ये nerves है. C and D. बोल सकते हो? What is that C and what is that D? Any guesses बच्चों? Perfect बच्चे. Very good आशुतोष. Excellent रामाशीष. जयंत, बढ़िया है. बहुत पढ़ रहे हो, बहुत है. Very good. बच्चों, infratemporal fossa में we find 2 nerves. 2 nerves होते हैं. हाँ, so which is that C nerve and which is that D nerve? C ऊपर की तरफ होती है, D नीचे की तरफ होती है. एक MCQ आया था, चलो ये भी बोल देता हूँ. Nerve related to the last molar tooth. Come on, take this from me. Nerve related to the last molar tooth. जब molar extraction करते हैं तो this nerve is injured and that is C. कौन है वो? कौन है? हाँ. Inferior. ये D is inferior alveolar. D is inferior alveolar. D is inferior alveolar. C कौन है बोलो? C. C is the nerve which is injured during extraction of the last molar tooth. तो बच्चों ने क्या लिखा मालूम है? Nerve injured during extraction of the last molar tooth. बच्चों ने लिखा inferior alveolar. गलत है, that's wrong. उसका आंसर है lingual nerve. lingual. So C is lingual. C is lingual nerve. तो ये याद रखना बच्चे, nerve damage during molar extraction आपका आंसर होगा lingual nerve, ना ही inferior alveolar. No, it is lingual nerve. याद रखना. Perfect है. Are you able to follow this? Yes. ये बहुत इंपॉर्टेंट विजुअल्स हैं. विजुअल्स बहुत इंपॉर्टेंट है. INICET में बहुत विजुअल्स भी आते हैं. सो बी वेरी क्लियर अबाउट दिस. परफेक्ट, वेरी नाइस. चलो लेट अस प्रोसीड. सो बाकी सब क्लियर है ना? इसके ऑप्शंस भी देख लो. ऑप्शंस आर, यू नो ऑल द ऑप्शंस नाउ, राइट. व्हाट इज दिस मसल? ये है टेम्पोरालिस. ये टेम्पोरालिस मसल है. फाइन, आई प्रोसीड. चलो, see the next MCQ. Fracture of jugular canal can present as. जुगुलर कैनल, फ्रैक्चर ऑफ जुगुलर कैनल. अब वैसे ना जुगुलर फोरामेन है. जुगुलर फोरामेन के 3 कंपार्टमेंट्स होते हैं. 3 कंपार्टमेंट्स होता है. दिस इज द एंटीरियर कंपार्टमेंट, दैट्स द मिडिल कंपार्टमेंट एंड दैट्स द पोस्टीरियर कंपार्टमेंट. एंटीरियर, मिडिल एंड पोस्टीरियर कंपार्टमेंट. व्हाट पासेस टू द एंटीरियर कंपार्टमेंट बोल सकते हो. एंटीरियर कंपार्टमेंट से जाती है इंफीरियर पेट्रोसल साइनस. इंफीरियर पेट्रोसल साइनस. मिडिल से जाती है 9th, 10th एंड 11th cranial nerves एंड पोस्टीरियर से जाती है sigmoid sinus. sigmoid sinus. sigmoid sinus. So jugular foramen के 3 कंपार्टमेंट्स हैं, एंटीरियर, मिडिल, पोस्टीरियर. एंटीरियर से जाती है inferior petrosal sinus, मिडिल इज 9th and 11th cranial nerves एंड पोस्टीरियर sigmoid sinus. So ये है glossopharyngeal, ये है वेगस, ये है accessory nerve. So आंसर क्या होगा? आंसर क्या होगा? आंसर क्या होगा? हाँ, what do you say? Loss of taste sensations in the posterior 1/3 of the tongue. Yes, this is the answer, right? Loss of taste sensation that is supplied by glossopharyngeal nerve. Perfect है. Loss of taste in anterior 2/3 ये कौन supply करता है? This is chorda tympani. Loss of taste sensations in the anterior 2/3, that's chorda tympani, which is a branch of facial nerve. Loss of taste sensations in the posterior 1/3, that's glossopharyngeal nerve. Loss of general sensations in anterior 2/3, that's lingual nerve. That's lingual nerve. And loss of motor sensations नहीं होगा, motor loss होगा. So motor loss, who supplies the tongue? Hypoglossal nerve. tongue को कौन supply करता है? Hypoglossal nerve. Perfect है? That's perfect. Excellent. Fine. See the next. Third part of vertebral artery is related to which of the following marked region in the following diagram? चलो बच्चों बोलो. Vertebral artery, ये बोल सकते हो vertebral artery. I'll draw a diagram for you. चलो एक diagram draw करता हूँ. This is the midbrain, that's the pons, that's the medulla, that's a cerebellum, that's a cerebellum. ठीक है? I'll just tell you the branches. Divide this cerebellum into 2 halves. यह है superior surface of cerebellum, यह है inferior surface. Inferior surface को 2 half में divide करो. Anterior, inferior, posterior, inferior surface. So cerebellum को 2 half में divide किया हमने. That's the superior surface. Inferior surface को 2 half में divide किया. Anterior, inferior, posterior, inferior. Fine. Now, these are the 2 vertebral arteries. Vertebrals will join to form the basilar artery. ये बन गई basilar artery. So, 2 vertebrals joins to form the basilar artery. What are the branches of vertebral artery? The 2 vertebral artery gives a artery in one single artery, that is anterior spinal artery. 2 arteries पीछे देती है. What is that? Posterior spinal artery. And the third artery goes and supplies the posterior inferior surface of the cerebellum, that's spica. Posterior inferior cerebellar artery. So what are the branches of vertebral artery? ये बहुत ज़्यादा important MCQ है. Branches of vertebral arteries: anterior spinal, posterior spinal and posterior inferior cerebellar artery. Thrombosis of this spica leads to Wallenberg syndrome, the lateral medullary syndrome or Wallenberg syndrome. याद रखना. So ये है branches of vertebral. ठीक है. अब basilar artery. Basilar artery के branches देखिए. Basilar artery gives branches to the pons. These are the pontine branches. An artery which goes to the internal acoustic meatus में जाती है. That's the labyrinthine. That's the labyrinthine artery. an artery going to the internal acoustic meatus, that's a labyrinthine artery, an artery which supplies the anterior inferior surface of the cerebellum, anterior inferior cerebellar artery, an artery which supplies the superior surface of cerebellum, that's a superior cerebellar artery, and two terminal branches, these are the posterior cerebral arteries. Posterior cerebral artery. So what are the branches of basilar artery? Branches of basilar artery, pontine branches, labyrinthine artery, anterior inferior cerebellar, superior cerebellar, and posterior cerebral arteries. Posterior cerebral arteries. So vertebral artery is a branch of first part of subclavian artery. Vertebral artery will begin from the subclavian artery. It will enter into the foramen transversarium. Okay. So from its beginning to the foramen transversarium, that's the first part. In the कौन से foramen transversarium में जाती है? C6 vertebrae के. Inside the foramen transversarium, that's the second part. Up the third part of the vertebral artery will lie here on the posterior arch of the atlas, and then it will enter the skull through the foramen magnum. That's the fourth part. That's the fourth part. ठीक है? So इसका आंसर क्या होगा? C. So third part of vertebral artery lies here. C नहीं है. Answer is this, D. D. आंसर D है ना बच्चे? क्या लिखा आपने? इसका आंसर D है. Third part of vertebral artery lies here. So first part from its beginning to the foramen transversarium. Second part inside the foramen transversarium. Third part from the foramen transversarium to the foramen magnum, and then the last part is in the foramen magnum. Fourth part is in the foramen magnum. So इसका आंसर होगा D. ठीक है बच्चों? क्लियर है? यस यस बच्चों. यस जयंत, रामाशीष, फाइन है. और कौन है? गौरी, मेडिको, कहाँ गए? सानिया. यस, कमन कमन आंसर. कमन बच्चों, बी इंटरैक्टिव. कमन, बी इंटरैक्टिव. फाइन. चलो, विल प्रोसीड देयर. Can anyone tell me the occipital condyles articulate with this? यहाँ पे होते हैं occipital condyles, बराबर है? That's the first cervical vertebra. ये है atlas. The occipital condyles will articulate here. What is the name of the joint? The atlanto-occipital joint. What is the type of joint? बोलो, what is the type of joint? Atlanto-occipital joint. What is the type of joint? Condylar joint. Condylar type of synovial joint, right? Condylar type of synovial joint. Atlanto-occipital joint. Atlanto-occipital. ठीक है. Fine, I'll proceed. Pivot नहीं है बच्चे. Pivot नहीं है. Atlanto-occipital joint is a condylar type of synovial joint. Pivot is atlanto-axial. Atlanto-axial is pivot. हाँ, वो pivot है. चलो, ये क्लियर है ना? ये डायग्राम याद रखना. ये डायग्राम याद रखना. ब्रांचेस ऑफ बेसिलर आर्टरी, ब्रांचेस ऑफ वर्टिब्रल आर्टरी बहुत ज्यादा इजी हो जाता है इसमें. Just remember this diagram. There are plenty of MCQs on branches of vertebral, branches of basilar. सब आते हैं MCQs में. चलो, shifting to the next one. Name the nerve supplying the marked area. चलो बच्चों, अब ये आइडेंटिफाई कर लो. टेल मी. I'll start like this. मैं ऐसे स्टार्ट करता हूँ. What is this A? What is this B? ये B कौन है? What is this C? What is this D? And what is this E? बोल सकते हो? Come on, answer this. Answer this. मैं देख रहा हूँ. I'm just sitting here and looking at the screen. चलो बोलो. पहले बोलो ये सेक्शन कहाँ से लिया है? What is the section of? That's a sagittal section of the larynx. ये larynx है. That's a section of the larynx. Now tell me what is A, what is B, what is C, what is D, and what is E? चलो बच्चों बोलो. पहले आंसर करो. ये पहले आंसर करो. What is A, B, C, D, E? Sagittal section of larynx. Very good, very good, very good. बहुत बढ़िया, बहुत बढ़िया. Your name is difficult to pronounce. Chiksu. Chiksu. बोलो. A कौन है? A. What is A? हाँ. What is B? B कौन है? Epiglottis. A कौन है? A. Ari epiglottic folds. Ari epiglottic folds. ठीक है ना? C कौन है? C. Vestibular fold. Vestibular fold. D कौन है? Vocal fold. E कौन है? Sinus of larynx. He is the sinus of larynx. Now Kiran. अच्छा, okay. Okay, now Kiran. Fine. Fine. So C कौन है? Vestibular fold है. D कौन है? Vocal fold है. And vestibular and vocal fold के बीच में the area is known as the sinus or the ventricle of the larynx. Sinus of the larynx or the ventricle of the larynx, right? अब बोलो, name the nerve supplying the sinus of the larynx. अब बोल सकते हो, what is the nerve supply of the larynx above the vocal folds? Come on, take this, answer this. Nerve supply of the larynx above the vocal folds. Take this question, answer this बच्चों, come on. तो ये vocal folds है ना, D is the vocal folds. So vocal folds के ऊपर nerve supply कौन है? The answer is internal laryngeal. Answer is internal laryngeal. And vocal folds के नीचे the nerve supply is recurrent laryngeal. Vocal folds के नीचे that's a recurrent laryngeal nerve. Perfect है? हाँ, perfect, perfect. Very good, very good. हाँ, very nice, very nice. अब एक याद रखना बच्चों, just remember this. Vagus divides into two main branches. एक है superior laryngeal nerve, दूसरा है recurrent laryngeal nerve. Superior divides into external laryngeal nerve and internal laryngeal nerve. External laryngeal nerve supplies the cricothyroid. External laryngeal nerve supplies the cricothyroid. External laryngeal nerve accompanies, yes, external laryngeal nerve accompanies the superior thyroid artery. बराबर है? So external laryngeal nerve accompanies the superior thyroid artery. External laryngeal nerve supplies the cricothyroid. Cricothyroid का action is tensor of the vocal cords. Tensor of the vocal cords is cricothyroid. अगर cricothyroid is damaged, the tensor action is lost. Loss of timbre of the voice. वो होता है loss of timbre of the voice, right? So ये बस ये table याद रखना. Superior laryngeal nerve divides into an external, internal. External laryngeal nerve accompanies the superior thyroid artery. वो बहुत MCQs आते हैं उस पे. हाँ, तो where to ligate the superior thyroid artery? हाँ, वो वाला. So external laryngeal nerve supplies the cricothyroid. Cricothyroid is the tensor of the vocal cords. If this cricothyroid is damaged, there's a loss of timbre of the voice. याद रखना. Internal laryngeal nerve बोल सकते हो. Internal laryngeal nerve pierces, pierces बोलो. The thyrohyoid membrane. Thyrohyoid membrane याद रखना, बहुत important है. Take this from me. Pierces the thyroid membrane, that's the internal laryngeal nerve along with the superior laryngeal artery, right? So internal laryngeal nerve along with the superior laryngeal artery pierces the thyrohyoid membrane and it supplies the sensory supply above the vocal folds. Supplies the larynx above the vocal cords. बराबर है? Recurrent laryngeal nerve बोल सकते हैं. Recurrent laryngeal nerve lies in the tracheoesophageal groove में होती है. ये tracheoesophageal groove में होती है. Accompanies the inferior thyroid artery. बराबर है? Supplies mucous membrane below vocal cords. Supplies sensory supply. मैं short में लिख रहा हूँ. Below the vocal cords. Also supplies all the muscles of the larynx except cricothyroid. Supplies all the muscles except cricothyroid. Except cricothyroid. बस ये टेबल याद रखना. Everything is done. सब कुछ हो जाता है इसमें. Everything is done if you know this table. सारे MCQs becomes clear. So all the muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. Perfect. Clear है? हाँ, तो ये MCQ clear है. Nerve supply of this is internal laryngeal nerve. हाँ, and ये table है, याद रखिए. Okay, let us proceed. Huh. So I'll just read this MCQ. A patient has undergone submandibular gland excision. Submandibular gland को निकाल दिया, ठीक है? And the Wharton's duct. What is Wharton's duct? It's the submandibular duct. वैसे parotid duct को क्या बोलते हैं? Parotid duct को हम बोलते हैं Stenson's duct. Stenson's duct is the parotid duct, and this parotid duct is piercing what? Buccinator. बच्चे मैंने आपको बोला what are the structures piercing the buccinator? Number 1, parotid duct. Number 2, ducts of molar glands, and number 3 is the buccal branch of mandibular nerve. Mandibular nerve. ठीक है, तो submandibular gland के duct को क्या बोलते हैं? Wharton's duct. While which of the following nerve is most likely to be damaged during process of ligating the duct? Yes, answer this. Answer is lingual nerve. Very nice, very nice. Answer is lingual nerve. Lingual nerve. So है ना, एक डायग्राम है, ये ऐसे एक मसल है. This muscle is the hyoglossus. बस ये आपको याद रखना है. This is the lingual nerve. This is the lingual nerve. Lingual nerve. Hanging from the lingual nerve is a ganglion. This is the submandibular ganglion. Submandibular ganglion. यहाँ पे एक gland होता है. Gland, that's a submandibular gland. And this is the duct of the submandibular gland. This is the Wharton's duct. Wharton's duct. ठीक है. So this Wharton's duct is going to loop around the lingual nerve. ये lingual nerve को ऐसे wind करती है. So when we are removing the submandibular gland and we are removing the submandibular duct, which nerve will be injured? Lingual nerve. Lingual nerve. वैसे है ना, यहाँ पे और एक nerve भी आती है, and and this is the hypoglossal nerve. Hypoglossal nerve. What is this muscle of the tongue? ये tongue का एक muscle है जिसका नाम है hyoglossus. The muscle is hyoglossus. Hyoglossus is therefore known as the key muscle of the oral region. Key muscle of the oral region. So this is hypoglossal nerve, that's lingual nerve. Okay, so key muscle of the oral region is, so मेरा कहने का मतलब है ये, key muscle of oral region is hyoglossus. Key muscle of the oral region is hyoglossus. Why? Because plenty of structures lie on the hyoglossus. इसके ऊपर कौन कौन है? एक तो lingual nerve है, फिर submandibular ganglion होता है, फिर submandibular gland होता है, and then submandibular duct होता है, and hypoglossal nerve होती है. All these structures are lying on the hyoglossus muscle. So hyoglossus is known as the key muscle of the oral region. वैसे की मसल ऑफ द ग्लूटियल रीजन बोल सकते हो बच्चों? की मसल ऑफ द ग्लूटियल रीजन. यस, कम ऑन, आंसर दिस. सो जैसे मेरे को ये मसल मिलता है ना, तो मोमेंट आई गेट दिस मसल, आई गेट एवरीथिंग इन दिस रीजन. आई गेट द सुपीरियर ग्लूटियल नर्व, द इंफीरियर ग्लूटियल नर्व एंड वेसल, सब कुछ मिल जाता है. सो व्हाट इज द की मसल ऑफ द ग्लूटियल रीजन? आंसर दैट. एनी गेसेस? I'm looking at the screen. Answer. Key muscle of the gluteal region. वैसा pear shaped muscle होता है ना. We'll come to that later. बाद में देखेंगे ये in the other MCQs. But I'm just telling you. Correlate करिए. ऐसे pear shaped muscle होता है. Name is from P. Answer. Name is from P. Piriformis. Very good. Name is from P. That's a piriformis muscle. Very good. Very good. So muscle का नाम है piriformis. So piriformis जैसे आपको मिलता है, you get everything in this region. So key muscle of the gluteal region हम बोलते हैं piriformis. Key muscle of the oral region, that's the hyoglossus. Right? Remember this. Perfect, 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 perfect. बाकी ये सब ठीक है ना? ये lingual nerve का और एक lingual nerve का और एक MCQ आता है. The nerve related, the nerve injured during the last molar extraction. So when the last molar tooth is being extracted, lingual nerve बहुत नजदीक से जाती है. Lingual nerve goes very close to the last molar tooth. So when we are removing the last molar tooth, the nerve injured is lingual nerve, not the inferior alveolar, not the inferior alveolar. बच्चे हमेशा गलती करते हैं, inferior alveolar लिखते हैं. No, but it is lingual nerve. याद रखिए. Perfect. चलो. Which pharyngeal arch does the pointed structure develop? चलो, answer this. ये easy है. Which pharyngeal arch does the pointed structure develop? ये मसल बोलिए, व्हाट इज दैट पॉइंटेड मसल? मसल का नाम बताओ. वेरी गुड ऑल ऑफ यू, वेरी गुड, यू आंसरिंग वेरी वेल. What is the name of this muscle which is pointed, which is inserted on the angle of the mandible but bahar ki taraf hai? This is on the outer side. Muscle inserted on the angle but outside. That's a masseter. Masseter. ये muscle है masseter. So जितने भी muscles हैं, muscles of mastication are derived from the first pharyngeal arch. First pharyngeal arch. So muscles of mastication. What else is there? और कुछ है? So muscles of mastication. Muscles of mastication. उसके साथ आता है टेंसर पैलिटी. टेंसर पैलिटी. उसके साथ आता है टेंसर टिम्पैनी. Then comes mylohyoid and anterior belly of digastric. Anterior belly of digastric, these are derived from the first arch. The nerve of the first arch is mandibular nerve. Nerve of the first arch is mandibular nerve. याद रखना, very important. This is very important MCQ. Embryology of head and neck बहुत ज़्यादा important है. Nerve of the first arch mandibular, second arch की nerve है facial, third arch की nerve है glossopharyngeal, fourth arch is superior laryngeal, sixth arch is recurrent laryngeal nerve. So mandibular nerve is the nerve of the first arch, and all the four muscles of mastication. So चार muscles of mastication है: temporalis, masseter, medial, lateral pterygoid, the tensor palatii, the tensor tympani, mylohyoid, anterior belly of digastric. All this is derived from the first pharyngeal arch. Remember this, very important. Fine, bachcho, come on. Are you able to follow this? Yes. See the next MCQ. This clinical condition occurs due to non-fusion of which of the following processes? बोलो बच्चों. What is this clinical condition? Clinical condition का नाम बोल सकते हो? What is this clinical condition? हाँ, वो clinical condition का नाम बोलो ना. What is the name of the clinical condition? This is known as a hair lip or cleft lip. Hair lip or cleft lip. So it is maxillary with the medial nasal process. Two medial nasal process gives, if the two medial nasal does not fuse, ये दो medial nasal processes fuse नहीं हुए, you get a cleft here. यहाँ पे cleft बनता है. If the two medial nasal processes do not fuse, you get a cleft here. This is known as a midline upper lip cleft. Upper lip cleft. So midline upper lip cleft is due to non-fusion of two medial nasal process. Maxillary with medial nasal process. This is the maxillary process. ये maxillary process does not fuse with the medial nasal process. You get a hair lip or a cleft lip. Hair lip or cleft lip. ठीक है? Maxillary process does not fuse with the lateral nasal process. You get an oblique facial cleft. Oblique facial cleft. If the maxillary process does not fuse with the lateral nasal process, you get an oblique facial cleft. And two mandibular processes do not fuse, you get a midline lower lip cleft. Lower lip cleft. A midline lower lip cleft is due to non-fusion of two mandibular processes. ये याद रखना. बस ये चार चीजें याद रखना. This is what is asked in the MCQs. यही पूछते हैं MCQs में. हाँ, काफी कवर किए ये. I mean, मैंने I can't tell you exactly, but काफी सालों के कवर किए. बहुत सालों के कवर किए. Plus I'm telling you what all important things can be asked. What are important things you should know, वो भी मैं बोल रहा हूँ. Right? Okay. Coming to the next, a 65 years old lady presents with a cerebrovascular accident involving the inferior frontal gyrus. Which functional area would most likely to be affected? Answer: inferior frontal gyrus. Inferior frontal gyrus. Any guesses? Inferior frontal gyrus. Yes. Answer this. So that's a central sulcus, precentral, postcentral, superior frontal, superior temporal, inferior temporal, parieto-occipital, calcarine, lunate sulcus. What is this? Area number 312, that's the primary sensory area. 57 is the sensory association area. This is 17 primary visual, 18 and 19 are the visual association areas. 17 is primary visual, 18, 19 is visual association areas. This is area number 41. Yeah, sorry, 41, 42. What is this? 41, 42. 41, 42 is, sorry, 41, 42 is primary auditory area. Primary auditory area. What is this? 22. 22 is Wernicke's area. Wernicke's area. 44, 45 lies in the inferior frontal gyrus. That's the Broca's area. That's a Broca's area. 44, 45 is Broca's area. ये inferior frontal gyrus में होता है. ये बहुत बार पूछता है बच्चे. So ये superior, middle and inferior frontal gyrus. यहाँ पे 44, 45 that's the Broca's area, right? This is area number 4, that's primary motor. 6 and 8 ये होता है premotor. 9, 10, 11 and 12 अंदर की तरफ होता है. 12 अंदर की तरफ. These are the prefrontal areas. Prefrontal. So 4 is primary motor. 6 and 8 is premotor. 8 is also known as frontal eye field. Number 8 को frontal eye field भी बोलते हैं. 9, 10, 11, 12 are the prefrontal areas. Prefrontal areas. Okay. So 22 is Wernicke's area, 44, 45 is Broca's area. And can you tell me what is this? Oh, ये क्या हो गया? What is this? Tell me what is this structure? What is this structure which connects these two areas? What is this? What is this tract which is connecting the Broca's and the Wernicke's area? Can you answer this? Can you answer this? बहुत इंपॉर्टेंट है ये, बहुत इंपॉर्टेंट है. Damage to this leads to conduction aphasia. Damage to this structure leads to conduction aphasia. ये क्या मैंने ड्रॉ किया है जो Wernicke's and Broca's को कनेक्ट करता है. What is that? हाँ, क्या लिखा है? आर्कुएट. हाँ, आर्कुएट fasciculus. वेरी गुड. इसका नाम है आर्कुएट fasciculus. इसका नाम है uncinate fasciculus. Same. Arcuate or the uncinate fasciculus connects the Wernicke's and the Broca's area. Wernicke's and Broca's area को connect करता है. ठीक है? Arcuate or the uncinate fasciculus. Perfect है बच्चे? Perfect है. Just remember this. Functional areas याद रखना. So answer is what? Auditory है ना? इसमें auditory answer होगा. Sorry. Answer is motor speech area. Motor speech area. Motor speech area. Sensory speech area is Wernicke's area. That's number 22. 22. Auditory areas are 41, 42. And visual areas are 17, 18, 19. Fine. Answer this. Which structure is supplied by the nerve causing this elevation? Answer this, bacho. Come on, answer this. Where are we? Bolo? What is this structure? Where are we? What is that structure? Where are we? Answer this. ये क्या देख रहे हो आप? What is this rhomboid shaped structure? What is this cavity known as? Any guesses? ये cavity का नाम? Come on. Name of this cavity. Yes, come on, answer. नहीं, ये cavity का नाम है fourth ventricle. This cavity is the fourth ventricle. बराबर, ये cavity fourth ventricle है. And what is this rounded structure? That's a facial colliculus. That's a facial colliculus, right? And this facial colliculus is formed by what? That's the abducens nucleus. That's the nucleus of abducens nerve. And this is the nucleus of facial nerve, the motor nucleus of facial nerve. The fibers of facial nerve come like this. The fibers of facial nerve come like this. ये बाहर की तरफ एलिवेशंस बनाते हैं, एंड दिस एलिवेशन इज नोन एज द फेशियल कॉलिकुलस. फेशियल कॉलिकुलस. So facial colliculus is formed by which nerve? The facial nerve. ये याद रखना, बहुत MCQs आते हैं इसमें. So facial colliculus is formed by the fibers of which nerve? Facial nerve. And which is the nucleus beneath the facial colliculus? The nucleus beneath the facial colliculus is abducens nucleus. Abducens nucleus. So if there's an injury to the nucleus beneath the facial colliculus, so answer is abducens nucleus. Muscle paralyzed would be lateral rectus. तब lateral rectus paralyzed होगा. अगर abducens nucleus को damage होता है तो lateral rectus will be paralyzed. If the fibers causing the facial colliculus are damaged, मतलब वो facial nerve है, facial nerve. Fibers causing the facial colliculus and facial nerve damage होता है. So answer for this is going to be rhizorius. Rhizorius होगा इसका answer. Levator palpebrae superior is supplied by third nerve. Third nerve. Superior oblique is supplied by fourth nerve. Fourth. And lateral rectus is supplied by sixth nerve. बराबर है ना? हाँ, ये क्लियर है? So अगर MCQ आता है, yes, very good, excellent. Answer for this is rhizorius. So अगर MCQ आता है damage to the fibers causing the facial colliculus, your answer would be facial then. The nucleus damage lying deep to the facial colliculus, your answer would be abducens nucleus. Then the answer would be abducens nucleus. ये याद रखिए. Perfect है? Okay. See the next. Identify the marked vein. चलो ये थोड़ा सा difficult है बच्चों. Can anyone tell me what is this marked vein? What is this marked vein? This marked vein, let me just tell you this. ये A है, ये B है, ये C है, and this marked vein is the D vein. D. This is a venous drainage of brain. Venous drainage of brain. हाँ थोड़ा सा ये difficult लगता है बच्चों को, but just tell me this. बोल सकते हो क्या? ग्रेट सेरेब्रल वेन लिखा है ना, क्या लिखा? ग्रेट सेरेब्रल वेन. नहीं, ये ग्रेट सेरेब्रल वेन नहीं है. दिस इज द बेसल वेन. दैट्स अ बेसल वेन. डी मार्क स्ट्रक्चर इज बेसल वेन. मार्क स्ट्रक्चर इज बेसल वेन. ठीक है. आई जस्ट ड्रॉ वन स्लाइड फॉर यू. देखो मैं एक स्लाइड ड्रॉ करता हूँ बच्चों, बस ये याद रखना है आपको, बस यही याद रखना है. व्हाट आई एम टेलिंग यू. लिसन. These are the three veins. This three veins joins to form a vein. These are the three veins. इससे एक वेन बनती है. This vein is known as the internal cerebral vein. Internal cerebral vein, same here, internal cerebral vein. Two internal cerebral vein joins to form. This is the कैसे लिखो इसको? Great cerebral vein. Great cerebral vein of Galen. Great cerebral vein of Galen, and this great cerebral vein of Galen drains into straight sinus. Straight sinus. Great cerebral vein drains into the straight sinus. This internal cerebral vein is formed by joining of three veins. तीन veins से बनती है internal cerebral vein. One is thalamostriate vein. Second is choroidal vein, and third is septal vein. बस यही याद रखना. Thalamostriate, choroidal and septal vein joins to form the internal cerebral vein. ये internal cerebral vein है. Two internal cerebral vein joins to form the great cerebral vein of Galen. The great cerebral vein of Galen drains into straight sinus. Now this great cerebral vein of Galen is joined by this is the basal vein. यह है basal vein. And this basal vein is formed by joining of three veins. ये basal vein तीन veins से बनती है. One is the anterior cerebral vein. Second is striate veins, and third is deep middle cerebral vein. अंडरस्टैंडिंग? बस ये याद रखना। तो ये वेन क्या था? बेसल वेन। मतलब ये क्या है? बेसल वेन। बेसल वेन इज फॉर्म बाय जॉइनिंग ऑफ ए कौन है? ए इज द एंटीरियर सेरेब्रल वेन। ए इज द एंटीरियर सेरेब्रल वेन। फिर जो बी था ना, एक मिनट, बी था ना, बी इज द डीप मिडिल सेरेब्रल वेन। बी इज द डीप मिडिल सेरेब्रल वेन एंड सी इज द स्ट्राइट वेन। बस ये टेबल याद रखना। दिस इज अ वेरी इंपॉर्टेंट, दिस इज माय पिक्चर, ये मैंने बनाया है वो, ठीक है। सो ये बेसल वेन है। बेसल वेन 3 वेन से बनती है, एंटीरियर सेरेब्रल वेन, डीप मिडिल सेरेब्रल वेन एंड स्ट्राइट वेन्स। इससे बनता है बेसल वेन। बेसल वेन गोज एंड जॉइंस विद द ग्रेट सेरेब्रल वेन ऑफ गैलन। ये जो ग्रेट सेरेब्रल वेन ऑफ गैलन है, दिस ग्रेट सेरेब्रल वेन ऑफ गैलन इज फॉर्म बाय जॉइनिंग ऑफ 3 वेन्स. The thalamus is formed by joining of 2 internal cerebral veins. Internal cerebral veins are formed by the joining of 3 veins: thalamostriate, choroidal and septal. बस बस ये स्लाइड याद रखना, ये याद रखना। Fine, clear to all of you? So that's a slide. Anterior cerebral and middle cerebral are branches of what? Anterior and middle cerebral are branches of internal carotid artery. Internal carotid artery के terminal branches हैं anterior and middle cerebral artery. So middle cerebral artery is a continuation of internal carotid. It's a continuation of internal carotid, middle cerebral artery. ठीक है बच्चों? Fine. Let's see the next. Okay, I'll just read this for you. A 24-year-old final year student, while delivering a presentation on the internal capsule, mentions that the internal capsule is a V-shaped structure. Fine. Made up of anterior limb, genu, posterior limb. Anterior limb, posterior limb, genu and body. और भी पार्ट्स है ना, anterior limb, genu, posterior limb, retrolentiform part and sublentiform part, वो भी तो है. She also mentions that the blood supply of internal capsule and ask about ischemia of which part of the internal capsule would lead to contralateral motor loss of the upper and lower limbs. मतलब which are the fibers which will cause this? These are the corticospinal fibers. Corticospinal fibers. तो ये MCQ क्या पूछना चाहता है? What is being asked? What is being asked? What is being asked? What is being asked? Can anyone tell me what is being asked? Corticospinal fibers pass through which limb of the internal capsule? ये पूछना है. Corticospinal fibers pass through which limb of the internal capsule? Anyone? Corticospinal fibers pass through which limb? बस इसमें ना 2-3 MCQs आता है internal capsule का, बस ये याद रखना. Corticospinal fibers pass through the posterior limb of the internal capsule. Corticospinal fibers pass through the posterior limb of the internal capsule. Corticospinal fibers pass through the posterior limb of the internal capsule. Fine. Through the genu. Genu से कौन जाता है? Genu से जाता है corticonuclear fibers. बस ये याद रखना. Genu of the internal capsule is corticonuclear fibers. Corticonuclear fibers. A posterior limb is corticospinal fibers. Corticospinal fibers pass to the posterior limb. Genu से जाता है corticonuclear fibers. Fine. Optic radiation passes through retrolentiform part and auditory radiation passes through sublentiform part. बस ये 4 याद रखना है आपको. This 4 you have to remember. ठीक है? So yes, all of you, where are you? Come on, answer बच्चों. Dhanush, the visual. कहाँ गए? रामाशीष, you're all there, no? हाँ, so बस ये 4 options है, ये 4 MCQs है जो बहुत important है. The corticonuclear fibers pass through the genu of the internal capsule. ये याद रखना. Corticospinal fibers pass through the posterior limb. The optic radiation passes through retrolentiform part and the auditory radiation passes through the sublentiform part. ये 4 चीजें याद रखना है, इस पे बहुत एमसीक्यूज आते हैं. Which is the main artery supplying the internal capsule? The middle cerebral artery. Main artery supplying the internal capsule होती है middle cerebral artery. Fine. I hope this is clear to all of you. चलो answer this. The marked cell inhibit which of the following structures? बच्चों बोल सकते हो what is the slide of? बहुत important slide है, बहुत बार पूछा गया है ये. It is asked plenty of times. What is the slide of? Come on, come on, come on, students, be interactive. Come on, be interactive. बोलो, ये कौन सी slide है? What is the slide of? चलो 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 आंसर करो. आई एम जस्ट लुकिंग एट द स्क्रीन. आई एम वेटिंग फॉर यू. ये कौन सी स्लाइड है? बोल सकते हो? दिस इज अ वेरी इंपॉर्टेंट स्लाइड है. ये स्लाइड आई गिव यू हिंट. मैं हिंट देता हूँ. इसके 3 लेयर्स होते हैं. वन इज द मॉलिक्यूलर लेयर, दिस इज द ग्रैन्युलर लेयर एंड दिस इज द Purkinje cell layer. So molecular layer, granular layer, Purkinje cell layer. What is that? What is the slide of? Come on. Answer, students, come on. Molecular layer, Purkinje cell layer and granular layer. Yes, where are all of you? कहाँ गए सब? This is a slide of cerebellum. Huh? So the sole input, जो sensory supply to the cerebellum is from sensory supplies to the Purkinje cell. The motor output from the cerebellum is the Purkinje cell. The motor output, the only motor output. The cerebellum is mainly sensory is cerebellum. The only motor output from the cerebellum is Purkinje cell. And this Purkinje cell will inhibit the deep cerebellar and the lateral vestibular nucleus. Deep cerebellar and the lateral vestibular nucleus. Deep cerebellar and the lateral vestibular nucleus. Okay, so Purkinje cell is going to inhibit the deep cerebellar and the lateral vestibular nucleus. ठीक है ना? Fine. Okay, sorry, I didn't see your. I couldn't see the comments. I couldn't see. Fine. So deep cerebellar and lateral vestibular. So that's a cerebellum. Just remember this. Very important slide. बहुत बार पूछा गया है. Now coming to the next MCQ. A 50 years old male, I'll sit and I'll just read the MCQ for you. A 50 years old male comes to the clinic with loss of taste sensations. Sensations were not felt on the anterior 2/3 of the tongue. Lesion of facial nerve was suspected. One of the following statements about this facial nerve is false. Yes, come on, answer. So facial nerve, बोल सकते हो इसका आंसर? एक मिनट, I'll just make a slide for you. Facial nerve enters into this foramen. ये foramen क्या है? Internal acoustic meatus. Facial nerve enters the internal acoustic meatus. That's the first bend of the facial nerve. इसको क्या बोलते हैं? Genu. What is this? This is the promontory. The facial nerve goes above the promontory. The facial nerve goes above the promontory, goes behind the promontory, and now gets out through the stylomastoid foramen. ये कौन है? That's a stylomastoid foramen. Enters into a gland here. What is this gland? That's a parotid gland. Parotid में जाती है and now gives 5 branches. Sorry. Oh. Okay, so facial nerve enters the internal acoustic meatus. ये internal ear में जाती है. There's a course of facial nerve in the ear. Then it winds, it goes above the promontory. ये promontory के पीछे से निकलती है, gets out through the stylomastoid foramen, and then enters the parotid gland, gives 5 branches to supply the muscles of face. ठीक है? Here it gives 3 branches. बोल सकते हो? The first branch is the greater petrosal nerve. Greater superficial petrosal nerve भी बोलते हैं. One is nerve 2 stapedius. हाँ, and तीसरा कौन है? तीसरा is cauda tympani. So greater petrosal nerve क्या करता है? Greater petrosal nerve supplies all the glands. It supplies which glands? Greater petrosal nerve supplies lacrimal, nasal, palatine, and pharyngeal glands. Greater petrosal nerve supplies the lacrimal, nasal, palatine and pharyngeal glands. Nerve to stapedius, वो stapedius को supply करती है. Chorda tympani nerve supplies the submandibular and the sublingual glands. Submandibular and the sublingual glands. It also supplies special sensations to anterior 2/3 of the tongue. Special sensations to anterior 2/3 of the tongue. Fine. Right, no? So ये है facial nerve in short. I've told you. Fine, perfect. So यहाँ पे injury होती है तो Bell's palsy. If the injury is here, everything else is intact. खाली Bell's palsy होगा. अगर यहाँ पे injury हो गया तो hearing is proper, that is proper. This will be lost. तो वैसे आपको define करना है lesions of facial nerve. You have to understand this lesions of facial nerve like that. Sorry. Now come to this. One of the following statement about this nerve is false. Supplies the stapedius. Correct. Yes, the facial nerve supplies the stapedius. No doubt about it. Facial nerve supplies the stapedius. Yes, it is attached to the brainstem at the pontomedullary junction. बराबर है ये. Pontomedullary junction पे 3 nerves attached होता है, 6th, 7th and 8th. So this is correct. Pontomedullary junction पे 6th nerve है, 7th nerve है, 8th nerve है. 3 nerves होता है pontomedullary junction पे. तो that is correct. Contains no special visceral afferent fibers. That's wrong. That's wrong. The special visceral afferent fibers, they go from the tongue. Tongue से special sensations लेके जाती है chorda tympani, right? So special visceral afferent fibers होते हैं facial nerve में, and it is carried by the chorda tympani to the nucleus of tractus solitarius. Nucleus of tractus solitarius. So tongue याद रखना, tongue. Nucleus of tractus solitarius gets sensations from the tongue. तो 3 nerves होंगे ना इसमें. Special sensations from anterior 2/3. कौन है? Chorda tympani. Special sensations from posterior 1/3 of the tongue. That's glossopharyngeal. And special sensations from the posterior most part of the tongue. That's vagus. मतलब ये जो nucleus of tractus solitarius होता है, this is a common nucleus for how many nerves? 7, 9 and 10. Nucleus of tractus solitarius, right? So contains no special visceral afferent. गलत है. The special visceral afferent fibers are from the tongue. They go to the nucleus of tractus solitarius and they carry special sensations. याद है? It's a content of parotid, correct. Content of parotid is correct. बच्चे एक बोल सकते हो nucleus ambiguous. It's a common nucleus. मतलब ये याद रखना, 2 nucleus है अपने पास. एक है nucleus of tractus solitarius and दूसरा है nucleus ambiguous. So nucleus ambiguous is a common nucleus. मतलब nucleus ambiguous is a motor nucleus है, and this is a sensory nucleus. That's a sensory nucleus. This is a common nucleus for 7, 9 and 10 cranial nerves, and this is a common nucleus for 9, 10 and cranial accessory. याद रखना ये. Just remember this 2 nucleus, बहुत important है, right? So nucleus of tractus solitarius, that's a sensory nucleus. Represents which functional component बोल सकते हो? ये कौन से functional component को represent करता है? Special visceral afferent component को represent करता है. Special visceral afferent component को represent करता है, and ये किसे represent करता है? Special visceral efferent component को. It supplies the muscles of pharyngeal arches. That is the special visceral efferent component. याद रखना बच्चों. हाँ? ये दोनों न्यूक्लियस को कंपेयर करिए. फाइन है. परफेक्ट, परफेक्ट. कम ऑन, लेट अस प्रोसीड. लेट अस प्रोसीड टू द नेक्स्ट एमसीक्यू. 22nd. Which of the following lobes of the lung is affected when there is aspiration in supine position? चलो बोलो, ये easy है. This you must be knowing. Aspiration in supine position. The most dependent part of the lung. बोल सकते हो, जब अपन सोते हैं तो सबसे dependent part of the lung क्या होता है? Which is the lowest part of the lung in supine position. तो aspiration करते हैं तो aspiration directly goes to the most dependent part of the lung. Anyone? Answer this. Any guesses? Any guesses? हाँ, क्या आंसर लिखा है? Right superior lobe. Right superior lobe. Right superior lobe is apicals B. Upper part of right inferior lobe. Upper part of right inferior lobe. Upper part of right inferior lobe is also fine. क्या क्या लिखोगे इसको? Superior basal segment है. Superior basal segment, right? Superior basal segment. उसको right superior lobe भी बोलते हैं, या upper part of right inferior lobe is also right. ये दोनों options correct है. Whether you answer B or C, that's fine. That's fine. Tell me, anything is fine. B and C दोनों options nearly same है. Tell me which is the most dependent part of the body in which is the most dependent part of the peritoneal cavity in supine position. बोल सकते हो? मतलब when we lie supine, any fluid in the peritoneal cavity will gravitate down into which pouch? कौन से pouch में जाएगा? Any fluid in the peritoneal cavity जब अपन supine lie करते हैं enters into the Morrison's pouch. Morrison's pouch. याद रखना, take this. This is very important. Any fluid in the peritoneal cavity in supine position goes to the Morrison's pouch. In standing position goes to the recto-uterine pouch in females and the recto-vesical pouch in males. Right? In females, it's the recto-uterine pouch. That's a pouch of Douglas, and males में होगा recto-vesical pouch. So fluid gravitates into this pouches. Very good. बहुत important है. Okay. ठीक है. So upper part of the right inferior lobe, right superior lobe. Anything you can answer. That's fine. Tell me, foreign body when it enters the nose enters into which segment of the lung? Foreign body जब nose में जाता है, it enters into the posterior basal segment. Posterior basal segment of the right lung. Foreign body, foreign body. याद रखना, foreign body जब nose में जाती है, it enters into the posterior basal segment of the right lung. Of the right lung. Posterior basal segment of the right lung. याद रखना. चलो, that's great. Come on, answer this. 23rd MCQ. I'll just read this for you. A 40 years old woman, gravida 2, para 1, at 24 gestation comes to physician for a routine prenatal evaluation. She has no history of major medical illness and takes no medications. Fetal USG shows a cardiac defect resulting from abnormal development of endocardial cushions. This defect is most likely to result in which of the following? Endocardial cushions. बोल सकते हो endocardial cushions. Anyone? मतलब see, this is the atrium. That's a ventricle. This is the AV cushion. हाँ, इसको बोलते हैं AV cushion or the endocardial cushion. हाँ, this is the septum spurium. ये septum spurium है. अब what is this septum? ये septum कौन है? Interatrial septum. ये है septum primum. हाँ, ये है septum primum. This septum primum will come and fuse with what? AV cushion. ये septum primum आके fuse किसके साथ होता है? AV cushion के साथ आके fuse होता है. If this AV cushion is not there, अगर AV cushion ही नहीं होगा, तो then where will the septum primum come and join to? समझ में आ रही है? तो अगर AV cushion नहीं होगा, suppose this AV cushion is not there, endocardial cushion नहीं है, so this septum primum has nothing to hold. कुछ है ही नहीं उसके पास, तो there'll be a atrial septal defects. Atrial septal defect होगा, ठीक है? Number second. अब second condition देखिए. This is the section. ये section है. कैसे draw करूं मैं आपको? Okay, चलो, I'll put it like this for you. So this is the endocardial cushion. अब ये ventricles देखिए, ventricles, हाँ, ventricles. In the ventricles, ये section लिया मैंने. This is the ventricle. Ventricle, हाँ. This part of the septum is known as the muscular part. Muscular part. So this is the muscular part of the interventricular septum. So interventricular septum का muscular part is derived from फ्रॉम द वेंट्रिकल्स. द interventricular septum का upper part is derived from, this is known as the bulbar septum. That's a bulbar septum. And the middle part, जो बीच में वाला part है, this is derived from the AV cushion. हाँ, तो ये वेंट्रिकल का मैंने सेक्शन लिया है. आई एम जस्ट ड्राइंग अ रिप्रेजेंटेटिव डायग्राम फॉर यू. तो ये वेंट्रिकल का सेक्शन लिया है, ये इंटरवेंट्रिकुलर सेप्टम मैंने बनाया. सो इंटरवेंट्रिकुलर सेप्टम मस्कुलर पार्ट इज डिराइव्ड इन द वेंट्रिकल. दिस इज अ मेम्ब्रेनस पार्ट. मेम्ब्रेनस पार्ट इज डिराइव्ड फ्रॉम बल्बार सेप्टम एंड द एवी कुशन. मतलब व्हाट आई एम टेलिंग यू इज, अगर एवी कुशन नहीं है, एवी कुशन इज नॉट देयर, इट विल रिजल्ट इन this part will not be formed. ये बनेगा ही नहीं. So that's a interventricular septal defect. Interventricular septal defect हो गया. Plus if this is not there, this AV cushion is not there, there will be an interatrial septal defect. समझ में आ रहा है? So अगर AV cushion बना नहीं, so there will be interatrial and the interventricular septal defects. That's the moral of the story. Understanding this, so अगर AV cushion नहीं होगा तो interatrial septum will not be formed. There will be a defect. Interventricular septum will not be formed. उसमें भी defect होगा. Understanding? समझ में आ रहा है ये? हाँ, हाँ. So this will be atrioventricular septal defects. The answer will be atrioventricular septal defect. Understanding? Tell me, phallus tetralogy. What is the main cause of phallus tetralogy? Phallus tetralogy का main cause क्या है? What is the main cause of TOF? The bulbar septum shifts to, समझ में आ रहा है ना? हाँ, yes. Okay. The bulbar septum shifts to the right side. So the main cause of TOF is pulmonary stenosis. The main cause of TOF is ये जो septum होता है ना, वो right side को shift होता है, right side पे shift. ठीक है, तो pulmonary stenosis हो गया. So pulmonary stenosis हो गया तो क्या हुआ? Pulmonary stenosis हो गया तो right ventricular hypertrophy हो गया. Right ventricular hypertrophy हो गया तो interventricular septal defects हो गया. Septal defect. Interventricular septal defect हो गया तो overriding of aorta हो गया. That is TOF. Overriding of aorta. So yeah, that is TOF. So what is the main cause of TOF? The main cause of TOF is pulmonary stenosis. Because pulmonary stenosis हो गया तो right ventricle has to contract. Right ventricular hypertrophy हो गया. Because of right ventricular hypertrophy, interventricular septal defect होता है. And because of interventricular septal defect, there's an overriding of aorta. This four conditions leads to TOF. ये TOF हो गया. Transposition of great vessels. Transposition of great vessels क्यों होता है? Because of improper spiraling of the septum. TGA, transposition of great vessels कब होता है? Because of improper spiraling of the septum. Septum spiral नहीं होता तो transposition होते हैं. Fine. I hope this is clear. Okay. ये याद रखना. This is very important MCQ. ये बहुत बार पूछा गया है. Okay, see the next. State the root value of the pointed structure. चलो ये बहुत important visual है आपके लिए. This is a very important visual. बच्चे, can you answer this slide? Come on, I'll start with this. What is this? कैसे लिखें आप? This is A, this is B, this is C, this is D. चलो बोलो. This is E. Answer this. ये कौन है? I'm looking at the screen. Answer this, बच्चों. What is phrenic nerve? Very good, very good. The marked structure is phrenic nerve. Root value is C3, C4, C5. हाँ, वो phrenic nerve है. वो कैसे याद रखोगे? Phrenic nerve goes in front of the hilum. Phrenic nerve hilum के आगे जाती है. वो answer is phrenic nerve. Perfect है. Answer phrenic nerve है. C3, C4, C5 phrenic nerve है. That's perfect. अब ऑप्शन देखो, who's E, who's B, who's C. C is phrenic nerve, D कौन है, E कौन, E is phrenic nerve, C कौन है, D कौन है? बोलिए बच्चों. आई टोल्ड यू phrenic nerve lies on a muscle. phrenic nerve जो है it lies on a muscle, याद है? So that muscle is C. C is scalenus anterior. Scalenus anterior. And D कौन है? Scalenus medius. Scalenus medius. So A has scalenus. C is scalenus anterior. Phrenic nerve is lying on which muscle? Scalenus anterior. And ये कौन है फिर? A कौन है? Brachial plexus. B कौन है? Subclavian artery. B is the subclavian artery. A is the brachial plexus. A is the brachial plexus, B is the subclavian artery, D is scalenus medius, C is scalenus anterior, and scalenus anterior के ऊपर है phrenic nerve जिसका रूट वैल्यू है C3, C4, C5. There's an accessory phrenic nerve, बोल सकते हो accessory phrenic nerve, उसका रूट वैल्यू accessory phrenic nerve C5 arises from C5 root of the brachial plexus. Accessory phrenic nerve arises from C5 root of the brachial plexus. ये याद रखना. So nerve in front of the hilum is phrenic. Nerve behind the hilum is vagus. Take this. Nerve in front of the hilum is phrenic nerve. Nerve behind the hilum is vagus nerve. That's very important. याद रखना. Behind the hilum is vagus. Fine. Okay. Coming to the next MCQ. A 60-year-old male is brought to the emergency department complaining of severe chest pain, and angiogram revealed thrombosis of SVC after entry of azygous vein. This condition would most likely cause dilatation of which of the following veins? Can you answer this MCQ? Any guesses? Answer this MCQ. Dilatation of which of the following veins? Chalo, I'll just draw this for you. Look, this is the internal jugular. That's a subclavian. Internal jugular. That's the internal jugular, subclavian. Internal jugular, subclavian. Right brachiocephalic, left brachiocephalic. SBC, azygous vein. Internal jugular, subclavian. Right brachiocephalic, left brachiocephalic. SBC, and that's the azygous vein. Fine. Okay. This is a subclavian vein. ये subclavian vein first strip को cross करती है. First strip को cross किया. Now this becomes the axillary vein. Axillary vein. What is this muscle? This muscle is pectoralis minor. Pectoralis minor. ठीक है. अब there's an obstruction to the SVC below the opening of azygous vein. बस ये समझ लो. Obstruction to the SVC below azygous vein. Obstruction to the SVC below the opening of azygous vein. यहाँ पे obstruction है. Blood goes up. Blood goes up. So blood goes into. The blood goes into. Just try to understand. The blood enters into. ऊपर जाता है ये blood. Brachiocephalic. Brachiocephalic से ये subclavian में जाएगा. Subclavian से ये axillary में जाएगा. Axillary के second part में there is a vein here. There's a vein here जिसका नाम है lateral thoracic vein. Lateral thoracic vein. So the blood will go to the lateral thoracic vein. ऐसे जाएगा. From the lateral thoracic vein, there's a vein जिसका नाम है Thoraco-epigastric vein. Thoraco-epigastric vein. Thoraco-epigastric vein will go into the superficial epigastric. Superficial epigastric will go into the great saphenous. Great saphenous into the femoral. Femoral to external iliac. common iliacs, IVC, right atrium. This is very important. ये बहुत important है, ये याद रखना. So when there's an obstruction to the SPC below the opening of aortic vein, the blood takes a alternate way. Alternate way से जाता है blood enters into the brachiocephalic से subclavian से axillary से lateral thoracic से thoraco-epigastric vein, thoraco-epigastric से superficial epigastric to great saphenous, femoral से external iliac, common iliac, IBC, right atrium. So blood goes into the right atrium from the lower limb से right atrium में जाता है, and which is a vein which is dilated during obstruction to the SVC. The answer for this is thoraco-epigastric vein. समझ में आया ये? This is the thoraco-epigastric vein. वो दो veins को connect करती है. It connects the lateral thoracic vein with the superficial epigastric vein. Lateral thoracic vein of the upper limb with the superficial epigastric vein of the lower limb. तो यहाँ पे एक dilated and tortuous vein होगा. नाम है thoraco-epigastric vein. याद रखना, बहुत important है. Take this. Fine, बच्चों समझ में आया? Answer for this is thoraco-epigastric. Yes, बोलो. Is this clear? Yes, wisdom. Visual vitals wisdom. Ashutosh Kumar. Answer is thoraco-epigastric. Very good. Good. All of you answering very well. बहुत अच्छा आंसर कर रहे हो. Interactive रहो. हाँ, थोड़ा बाकी है. We'll finish this. Come on. Answer the next one. Posterior boundary of the mark structure is. Answer, what is this mark structure? ये जो mark किया ना, वो structure क्या है? What is this mark structure? Answer this. Answer. Come on. ये easy है. This you must be knowing. ये आपको पता होगा. What is this mark structure? Come on, बच्चों. Come on. You can answer this. Yes, you can answer this. Mark structure. हाँ, epiploic foramen. You got this. Lesser sac नहीं है बच्चे, ये epiploic foramen है. Epiploic foramen है बच्चे. Epiploic foramen. So now you tell me. Posterior boundary of epiploic foramen is formed by. हाँ, answer this. Posterior boundary of epiploic foramen is formed by IBC. ये posterior boundary हो गया. हाँ, superior boundary is formed by. Superior boundary would be formed by caudate lobe. Caudate lobe. Superior होगा caudate lobe. Inferiorly होगा first part of the duodenum. Inferiorly would be the first part of the duodenum. Anteriorly would be the lesser omentum. आगे होता है lesser omentum containing hepatic artery, portal vein, bile duct. So epiploic foramen ये है, इसके आगे lesser omentum containing hepatic artery, portal vein, bile duct. पीछे होता है IVC, ऊपर होता है caudate lobe, and नीचे होता है the first part of duodenum. Right? Just remember all this. Answer is IVC. Perfect. Easy है वो. Dorsal mesogastrium gives rise to all the following structures except. बोल सकते हो? What is the answer for this? Another very important MCQ. एक छोटा सा डायग्राम ड्रॉ करता हूँ आपके लिए. चलो, I'll draw a diagram for you. You are answering very well. तो आपके लिए खास ये डायग्राम है stomach. Okay, especially for you. So that's a ventral mesogastrium. That's a dorsal mesogastrium. ठीक है? So ये stomach है. Stomach anterior abdominal wall को connected होता है ventral mesogastrium से. Stomach पीछे की तरफ connected है dorsal mesogastrium से. Okay, what develops in the ventral mesogastrium? Here is the liver. ये कौन है? Liver. ठीक है? And यहाँ पे कौन develop होता है? Spleen. ये spleen form हो गया. So what develops in the ventral mesogastrium is the liver. अब जैसे liver is formed in the ventral mesogastrium, it divides the ventral mesogastrium into two parts. बोल सकते हो? What is this? This becomes the lesser omentum, and this becomes the falciform ligament. So जैसे liver form होता है ventral mesogastrium में, it divides the ventral mesogastrium into a falciform ligament and lesser omentum. So what are the derivatives of ventral mesogastrium? It's the falciform ligament, it's the lesser omentum. प्लस जितने भी लिगामेंट्स होते हैं लीवर के, द सुपीरियर लेयर ऑफ कोरोनरी लिगामेंट, इंफीरियर लेयर ऑफ कोरोनरी लिगामेंट, द राइट एंड द लेफ्ट ट्रायंगुलर लिगामेंट्स, all this is derived from ventral mesogastrium. Dorsal mesogastrium में spleen form हो गया. The spleen divides this dorsal mesogastrium into, one is gastrosplenic, linorenal ligament, gastrophrenic, and third is greater omentum. Fine. So what are the derivatives of dorsal mesogastrium? याद रखना बच्चों, बहुत important है. Take this from me. The gastrophrenic ligament, the great omentum, the linorenal, and the gastrosplenic ligament. So these are the derivatives of dorsal mesogastrium. Ventral mesogastrium के derivatives है falciform ligament, less omentum, and जितने भी ligaments है liver के, the superior, inferior layer, and the triangular ligaments, all derived from ventral mesogastrium. Perfect. Answer is C. Okay, fine. I hope this is clear to all of you. Proceeding to the next MCQ. Okay, I'll just sit and read this. Answer this. A 35-year-old male complains of severe pain in the abdomen since several days. Gastroscopy revealed an ulcer in the posterior wall of the first part of duodenum. So ulcer is there in the posterior wall of the first part of the duodenum. A surgery is planned to repair the ulcer site. The artery erodes which of the following? बोल सकते हो? The artery erodes which of the following structures? तो थोड़ा सा गलत है ये MCQ, but can you tell me which is the artery there? Which of the following arteries eroded? ऐसा है. Which of the following arteries eroded? In other words, answer is gastroduodenal. Perfect, very good. Very nice. You got this right. Yes, answer is gastroduodenal artery. So which is the artery lying behind the first part of the duodenum? That's a gastroduodenal artery. Perfect. याद रखना, बहुत इंपॉर्टेंट है, हमेशा पूछते हैं ये. गैस्ट्रोड्यूडनल आर्टरी के साथ पोर्टल वेन भी होती है, बाइल डक्ट भी होता है. पोस्टीरियर रिलेशंस ऑफ द फर्स्ट पार्ट ऑफ duodenum. Perfect. A horseshoe shaped kidney remains at what vertebral level? बोल सकते हो बच्चों, horseshoe shaped kidney मतलब किडनी इज फॉर्म्ड इन द पेल्विस. अब किडनी जब ऊपर आती है टुवर्ड्स द लंबा रीजन, अपने घर तक पहुंचती है वो. सो इफ दैट्स अ horseshoe shaped kidney, it will be obstructed by which is this? What is this structure? ये स्ट्रक्चर कौन है? What is this structure? मतलब वो है ना, वो एओर्टा है, एओर्टा. ये एओर्टा है, एंड दिस इज अ वेंट्रल ब्रांच. वेंट्रल ब्रांच फ्रॉम द एब्डोमिनल एओर्टा. तो अगर horseshoe shaped kidney will remain obstructed here. यहाँ पे obstruct हो जाती है. What is that structure? As artery का नाम बोलो. Which artery is that? Inferior mesenteric. Very good. Artery is inferior mesenteric artery. Inferior mesenteric artery का vertebral level is L3. Come on students, L3. Inferior mesenteric artery का vertebral level is L3. So answer होगा इसका L3. Superior mesenteric artery is L1. Celiac trunk is T12. So this will be obstructed by inferior mesenteric artery. ये inferior mesenteric artery उसको prevent करेगा from going upwards. Level of inferior mesenteric artery is L3. So horseshoe shaped kidney remains below L3. Below L3. Easy है. This has been asked. ये याद रखना, ठीक है. Ventral branches, celiac trunk, superior mesenteric, inferior mesenteric. याद रखना. Okay, answer this. A 25-year-old man with ruptured appendix is brought to the emergency department for surgery. To do an emergency appendectomy, the surgeon has to ligate which of the following arteries? Answer this. Which of the following arteries? एक मिनट, I'll just tell you the branches of superior mesenteric. चलो आपको ये पता होगा, but superior mesenteric artery के branches आप बता सकते हो. Superior mesenteric artery का first branch is the inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery. फिर jejunal and ileal branches. Jejunal and ileal branches. Then comes middle colic. Then comes right colic. Then comes इलियोकोलिक. इलियोकोलिक का एक ascending branch आता है, descending branch आता है. Descending branch gives 4 branches. Descending branch gives anterior cecal, posterior cecal, appendicular, and ileal. हाँ, तो आंसर इज इलियोकोलिक. बट अगर बहुत स्पेसिफिक पूछा गया है, so the next option is going to be the appendicular artery. Appendicular artery is a branch of descending branch of ileocolic. Appendicular artery is a branch of descending branch of ileocolic. ठीक है. अब the last arteries, inferior mesenteric artery. Inferior mesenteric के branches left colic, sigmoid branches, and तीसरा कौन है? Superior rectal artery. The superior rectal artery is a continuation of inferior mesenteric artery. याद रखना, superior rectal artery is a continuation of inferior mesenteric artery. Perfect है. ये easy है. This you must be knowing. So fine. चलो answer this. A 42 years old woman comes to a physician because of right flank pain that started 3 days ago. Her vital signs are within the normal limits. Physical examination shows a right costovertebral tenderness. Costovertebral tenderness, क्या है वो? Something with respect to the kidneys. Yes, IVP shows a dilated renal pelvis and the ureter on the right side with lack of contrast proximal to UV junction. The patient most likely underwent which of the following surgeries? Answer this. Answer is hysterectomy. आंसर है हिस्टेक्टोमी. और प्रीवियस एमसीक्यू का आंसर क्लियर है ना? इसका एमसीक्यू है इलियोकोलिक आर्टरी, इसका एमसीक्यू इज इलियोकोलिक. फाइन. सो आंसर फॉर दिस इज हिस्टेक्टोमी. मतलब answer for this is hysterectomy. You know, no, on either sides of the uterus, the ureter cross the uterus. So when the hysterectomy is done, the structure damaged would be the ureters. Appendectomy के time, which is the nerve injured during appendectomy? बोल सकते हो? The nerve injured during appendectomy. हाँ, ureteric injury. Very good बच्चों, very good. You are excellent. You are doing very well. ऐसे ही लगे रहना. You'll definitely get good marks. If your basics are strong, no, preclinical subjects पे जिसका confidence होता है ना, उसका हमेशा अच्छा rank आता है. ये याद रखना. Take this from me. I've been teaching since last 25 years for the NEET PG entrances. I've seen students जिसका confidence basic sciences पे होता है ना, they always exceed. Right? Good. All of you answering well. ये बताना, जब appendectomy करते हैं तो which nerve is injured? इलियो हाइपोगैस्ट्रिक नहीं है बच्चे. इलियो हाइपोगैस्ट्रिक नहीं है. इलियो इनग्वाइनल है वो. इलियो हाइपोगैस्ट्रिक नर्व इंजरी नहीं होती है एपेंडेक्टमी के टाइम. इट्स इलियो इनग्वाइनल. फाइन. ओके. आंसर दिस. All the following arteries are branches of posterior division of internal iliac except. Can anyone answer this? Posterior division of internal iliac. Any guesses? Come on. You can answer this, students. Come on. सबने इलियो हाइपोगैस्ट्रिक लिखा है. Answer this. All the following are branches of posterior division of internal iliac. बोल सकते हो ये internal iliac. ये याद रखना बच्चों. Another very important MCQ is this internal iliac. इसके दो डिविजन्स होते हैं, anterior division and posterior division. Anterior division के branches है superior vesicle, inferior vesicle, हाँ, superior vesicle, inferior vesicle, middle rectal, uterine and vaginal. Superior vesicle, inferior vesicle, middle rectal, uterine vaginal, obturator, and two terminal branches, inferior gluteal and internal pudendal. inferior gluteal and internal pudendal. Posterior division के branches, posterior division के branches is superior gluteal, lateral sacral, iliolumbar. iliolumbar. Just remember this. ये याद रखना बहुत इंपॉर्टेंट है, बहुत इंपॉर्टेंट है. ओके, फाइन फाइन फाइन, ठीक है. लैप लैप इलो इंग्वानल नर्वस इंजर्ड. ठीक है, ठीक है. वो हर्निया होता है ना, फिर हर्निया होता है. Okay, fine. So internal iliac, anterior division के superior vesicle, inferior vesicle, middle rectal, obturator, uterine vaginal, inferior gluteal, internal pudendal, superior gluteal, lateral sacral, iliolumbar. बस ये याद रखना, इस पे MCQs आते हैं. Branches of internal iliac. ठीक है. So answer for this is inferior vesicle. Fine. Okay. Okay, fine. See the next. Chalo, I'll just read this MCQ. A male newborn is delivered at term to 30 years old woman. Pregnancy and delivery were uncomplicated. At birth, umbilical cord is noted to be large. When the newborn cries, straw-colored fluid leaks from the umbilicus. The external genitals appears to be normal. Which of the following is most likely cause of this newborn symptoms? बोल सकते हो? Answer this. Look, that's the bladder, that's the urinary bladder, that's the umbilicus. In fetal life, from the urinary bladder to the umbilicus, इसे क्या बोलते हैं? Urachus or allantois. Urachus or allantois. Okay. In fetal life, there's a communication between the urinary bladder and the umbilicus. इसे हम बोलते हैं urachus or allantois. ठीक है? After birth क्या होता है? This is obliterated. ये obliterate हो जाता है. After birth, this becomes the median umbilical ligament. After birth, this becomes the median umbilical ligament, right? अगर ये obliterate नहीं हुआ, if this does not obliterate, the child will be passing urine through the umbilicus, and this is what we call as the urinary fistula or weeping umbilicus. Weeping umbilicus. Understanding? So that's a urinary fistula or the weeping umbilicus. Perfect है बच्चों? वैसे ही this is a loop of the midgut. ये midgut की loop है. It communicates with the umbilicus. The loop of the midgut communicates with the umbilicus. This is known as the white-line duct. White-line duct. इसको बोलते हैं white-line duct और vitelo-intestinal duct. ठीक है? अगर ये vitelo-intestinal duct obliterates, ये चला जाता है, it obliterates. Fine. Suppose if this vitelo-intestinal duct remains persistent, अगर ये persistent रहा, तो this is what we call as fecal fistula. अगर ये पूरा persistent रहा, तो that becomes a fecal fistula. But most of the times, the proximal part remains persistent. And this part is obliterated. ये part obliterate हो जाता है and the proximal part remains persistent, and this is what we call as Meckel's diverticulum. Meckel's diverticulum. Fine. So what is Meckel's diverticulum? It's the persistent proximal part of white-line duct. Persistent proximal part of white-line duct is known as the Meckel's diverticulum. फाइन है बच्चे. तो ये white-line duct याद रखना, allantois याद रखना, fetal life में ये दो connections होते हैं, वो याद रखना. So what is the answer for this? Failed obliteration of allantoic remnants. White-line duct I have told you. ये clear है ना बच्चों? Is this clear? हाँ, Meckel's diverticulum. Fine. So persistent proximal part of white-line duct is known as Meckel's diverticulum. अगर पूरा persistent रहेगा तो fecal fistula होता है. Fine. Okay. Chalo, we'll proceed. All the following structures lie in the superficial perineal pouch except. बोल सकते हो? Can you answer this? All the following structures lies in the superficial perineal pouch except. I'll just make this for you. Superficial perineal pouch, and that's a deep perineal pouch. Superficial perineal pouch में muscles कौन से होते हैं? Ischiocavernosus, bulbospongosus, transverse perini, superficial. Transverse perini is superficial. So ischiocavernosus, bulbospongosus, and transverse perini is superficial. ठीक है? In females, there are glands which are known as Bartholin's gland. Bartholin's or greater vestibular glands. So greater vestibular glands are the contents of superficial perineal pouch in females. Baki ischiocavernosus, bulbospongosus, transverse perini is superficial. That's in the superficial pouch. In the deep perineal pouch, you have got sphincter urethrae and deep transverse perini, and in males you got the bulbo glands, bulbourethral glands. बस ये टेबल याद रखना, that's it. So superficial perineal pouch, deep perineal pouch, ये common है males and females के लिए. Clear to all of you? So this is both common for males and females. Deep में sphincter urethrae and deep transverse perini. In males there are bulbourethral glands. And females में in the superficial perineal pouch, Bartholin's glands or the greater vestibular glands. Fine. Just remember this. It will be very clear to you. So what is the answer for this? All the following structures lie in the superficial perineal pouch except bulbourethral glands. Bulbourethral glands lie in the deep perineal pouch in males. ठीक है? Bulbourethral glands lie in the deep perineal pouch in males. This is important. बस ये याद रखना है. Nothing else. ठीक है? चलो बच्चों, come on, can you identify this histology slide? Come on, take this very important slide. बोल सकते हो what is this slide? Without looking at the options. Options नहीं देखना है, मैं options को cover कर रहा हूँ. Options नहीं देखना है आपको. क्या लगता है? What is this slide? Okay. This is a special effort taken by PW MedEd. बच्चों आपके लिए specially for INICET appearing students. Do well in the exams. ठीक है? चलो answer this slide. ये slide क्या हो सकता है? क्या हो सकता है ये slide? ये जो देख रहे हो ना, all these things that you're looking at, ये जो सब देख रहे हो ना, ये सब देख रहे हो ना, these are the serous acinus. Serous acinus. तो इफ आई सी ओनली दिस, ये मैं बस ये देख रहा हूं, तो मैं इसको लेबल करूंगा अ सीरस सलाइवरी ग्लैंड. इसको मैं लेबल करूंगा सीरस सलाइवरी ग्लैंड, है ना, पैरोटिड. तो इफ आई सी ओनली दिस, मैं इसे लेबल करूंगा सीरस सलाइवरी ग्लैंड. एग्जांपल इज पैरोटिड ग्लैंड. बट द मोमेंट आई लुक एट दिस, बच्चों ये देखो, इस पे फोकस करो. व्हाट इज दिस? दिस आर द आइलेट्स ऑफ लैंगरहैंस. ये है आइलेट्स ऑफ लैंगरहैंस. तो ये बना पैनक्रियास. You understanding? So this is the islets of Langerhans and this becomes the pancreas. So pancreas अगर आप देखते हो, pancreas किधर गया? Pancreas is having exocrine part, and endocrine part. Exocrine part is serous acinus. and endocrine part is islets of Langerhans. Endocrine part is islets of Langerhans. समझ में आया? So बच्चों, before you label that, just see the slide properly. ठीक है ना? अगर ये नहीं रहेगा ना, if this is not there, suppose अगर ये नहीं है, so then that's a serous salivary gland. Why? Because you are seeing the serous acinus. तो फिर आप label करो serous salivary gland. But जब ये दिखता है, तो that is a pancreas. So example of a serous salivary gland, that's parotid. Parotid is serous salivary gland. Submandibular gland is a mixed gland. Mixed salivary gland is submandibular, that's a mixed gland. Mixed. Sublingual is mucus. Sublingual, and parotid is serous salivary gland. So serous salivary gland is parotid. Mucous salivary gland is sublingual. Submandibular is a mixed salivary gland. Fine. Perfect. Okay, coming to the last set of MCQs. Bacho, come on. State the nerve supply of the pointed structure. Bol sakte ho, what is this? Easy, and this is easy. Come on, students, come on. Have some energy and answer. Some last set of MCQs are left. Come on, answer this. बाकी जनरल हिस्टो के स्लाइड्स है वो इजी है. कम ऑन, हैव सम एनर्जी, पंप इन सम एनर्जी एंड आंसर. कम ऑन, एग्जाम्स नजदीक आ रहे हैं. बी एक्टिव. व्हाट इज दिस? हाँ, ये लॉन्गेस्ट मसल है. मसल का नाम बोलो बच्चे, मसल का नाम बोलो. द लॉन्गेस्ट मसल इन द बॉडी. Origin है anterior superior iliac spine. Insertion is on the medial aspect of the shaft of tibia. मसल है sartorius. दूसरा नाम क्या है? हनीमून मसल. sartorius is known as honeymoon muscle. What is the action on the hip joint? hip joint पे action क्या है? hip joint पे action is abduction, lateral rotation and flexion. Action on the hip joint. Abduction, lateral rotation and flexion at the hip. On the knee joint पे क्या होगा? Flexion and medial rotation. Flexion and medial rotation at the knee joint. ठीक है? So this is what we call as a honeymoon muscle, which is an anti-rapist muscle. Brachialis. Brachialis is an anti-rapist muscle. Sartorius is honeymoon muscle. याद रखना, honeymoon muscle, it does abduction, lateral rotation, flexion at the hip, flexion and medial rotation at the knee joint. Honeymoon muscle. याद रखना. Fine. See the next. Okay, I'll just sit and read this. A 30-year-old female complains of swelling in the groins. On examination, a small mass is seen protruding in this area. The surgeon diagnoses this as the femoral hernia. While considering the femoral sheath and femoral canal, which of the statement is incorrect? Okay, बच्चों, तो बोलो femoral sheath. एक थोड़ा सा डिस्कस करते हैं इस पे. femoral sheath जो है, femoral sheath, how is the femoral sheath formed? The femoral sheath is formed by two fascias. दो fascias होते हैं जो femoral sheath बनाते हैं. What are these two fascias which forms the femoral sheath? So anteriorly कौन है? Anteriorly is the fascia transversalis. Anteriorly, posteriorly is the fascia iliaca. So anteriorly is the fascia transversalis, posteriorly is the fascia iliaca. इसके तीन compartments होते हैं, तीन compartments of the femoral sheath. What is there in the lateral compartment? Femoral artery plus the femoral branch of genitofemoral nerve. Intermediate compartment में होता है femoral vein, and the medial compartment is empty. This is what we call as the femoral canal. Femoral canal. The upper part of the femoral canal is known as the femoral ring. Femoral ring. Fine. So femoral sheath जो है, how is the femoral sheath formed? Anteriorly is fascia transversalis, पीछे होता है fascia iliaca. Femoral sheath के तीन compartments है. Lateral compartment में होती है femoral artery plus the femoral branch of genitofemoral nerve. Genital branch of genitofemoral nerve कहाँ पे होता है? Spermatic cord में, on the round ligament of uterus. That's the genital branch of genitofemoral nerve. This is the femoral branch of genitofemoral nerve. Intermediate compartment में है femoral vein and medial compartment is empty. We call this as femoral canal. Upper part of femoral canal को हम बोलेंगे femoral ring. ठीक है? Now see the MCQs. The femoral sheath is continuous with fascia transversalis. Yes, it forms the posterior wall of the femoral sheath. Anterior wall. It forms the anterior wall of the femoral sheath. Posterior wall is formed by fascia iliaca. The sheath contains the femoral nerve. Galat. Femoral sheath में नहीं होता. Femoral nerve is outside the femoral sheath. Femoral nerve है ना. Femoral nerve is outside the femoral sheath. याद रखना. Femoral nerve femoral sheath के बाहर होता है. What is this nerve? This is the femoral branch of genitofemoral nerve. यह femoral branch of genitofemoral nerve. Femoral nerve is not a content of femoral sheath. Femoral canal is the medial content. The canal is wider in females. Yes, the canal is wider in females. Canal के बदले ring होगा. The femoral ring is wider in females. Femoral canal के बदले ring बोलो. The femoral ring is wider in females. Why? Femoral ring is wider in females because the vessels are small. The vessels are smaller in diameter. The pelvis is large. Pelvis large होता है, vessels छोटे होते हैं, तो femoral ring is wider in females. So chances of femoral hernia are more common in females. How do I differentiate a femoral hernia with a inguinal hernia? बोल सकते हो? What is the point of reference? वो point of reference क्या है? Femoral hernia and inguinal hernia के बीच में what is that? That's something which is very important. Answer that. Come on, bachcho, answer that. How do I differentiate a femoral hernia from an inguinal hernia? There's something landmark there. क्या है होता है वो landmark? Any guesses? Any guesses? Come on. क्या? Pubic tubercle. Very good. Excellent. बहुत अच्छा बच्चे. That's pubic tubercle. Pubic tubercle. Pubic tubercle के नीचे होगा femoral hernia. Pubic tubercle के upper and medial is inguinal hernia. Excellent. So pubic tubercle के ऊपर and medial is inguinal. Pubic tubercle के नीचे and lateral is femoral hernia. Excellent. Very good. You all will score excellent marks. Take this from me. Okay, answer this. Superior gluteal nerve supplies all the following muscles except. Easier. Come on, answer this. Superior gluteal nerve supplies all the following muscles except gluteus maximus. Gluteus maximus is supplied by inferior gluteal nerve. Gluteus maximus is supplied by inferior gluteal nerve. The gluteus medius minimus and tensor fascia lata is supplied by superior gluteal nerve. ये बहुत बार पूछा गया है. याद रखना. Yes. ठीक है ना? Easier. And injury to the superior gluteal nerve results in Trendelenburg's sign. Trendelenburg's sign. Perfect. Okay. Very good. See the next. Identify the pointed structure. Okay, बच्चों, ये मैं बोल रहा था आपको. This is what I was telling you, and this is the key muscle of the gluteal region. Yes, take this. This is the key muscle of the gluteal region. नाम है piriformis. Piriformis. That's the piriformis. ये ना बहुत बार visual आया हुआ है. This many times the visual has come. Come on, बच्चे, can you identify this? What is this nerve A? What is this nerve B? What is this nerve C? And what is this nerve D? ये identify कर लो बस. हाँ, A nerve कौन है? A की nerve है जो piriformis के ऊपर है. There's only one nerve above the piriformis, and that's a superior gluteal nerve. This superior gluteal nerve is going to supply the gluteus medius minimus and tensor fascia lata. बाकी सब piriformis के नीचे होता है. This is the inferior gluteal nerve, है ना? Inferior gluteal nerve supplying the gluteus maximus, sciatic nerve, posterior cutaneous nerve thigh. Posterior cutaneous nerve thigh. ठीक है? Okay, fine. ये clear है ना? What is this? This is the piriformis. A कौन है? Piriformis. B कौन है? B is the superior gemellus. C is obturator internus. D is inferior gemellus. E is quadratus femoris. Quadratus femoris. बस ये याद रखना in case if it comes. अगर आ गया तो. हाँ, बस ये याद रखना, दिस इज वेरी इंपॉर्टेंट, बहुत बार पूछा गया है ये एमसीक्यू भी. दिस विजुअल इज आल्सो आस्क्ड मेनी टाइम्स. हाँ, तो ये सुपीरियर ग्लूटियल नर्व याद रखना, ये इंफीरियर ग्लूटियल नर्व, दैट्स अ sciatic nerve, that's a posterior cutaneous nerve thigh, and these are the pin structures, PIN, pin. Pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. Name the nerve supplying the muscle causing this action at the ankle joint. What is this action at the ankle joint? पहले बोलो. What is this action at the ankle joint? You are standing on the tip of your toes. What are you doing to the ankle? वैसे ankle joints पे दो ही movements है, एक है dorsiflexion, एक है plantarflexion. One is dorsiflexion, one is plantarflexion. So when you are standing on the tip of your toes, what is the action? Action क्या है बोलो बच्चे? Action क्या है? पहले बोलो action क्या है? देखो ऑप्शंस नहीं देखना बच्चे, पहले व्हेन यू आर सॉल्विंग द एमसीक्यूज ना, पहले स्टेम ऑफ द एमसीक्यूज देखो, कम टू अ कंक्लूजन एंड देन यू सी द ऑप्शंस. पहले ऑप्शन नहीं देखना. डॉर्सिफ्लेक्शन नहीं है बच्चे, डॉर्सिफ्लेक्शन नहीं है. देखो ना, यू स्टैंड ऑन द टिप ऑफ योर टोज, देखो यू स्टैंड ऑन द टिप ऑफ योर टोज, योर फुट गोज डाउन, दैट्स प्लांटाफ्लेक्शन. ये डॉर्सिफ्लेक्शन नहीं है. डॉर्सिफ्लेक्शन इज व्हेन यू आर वॉकिंग ऑन द हील, हील पे जब चलते हो तो दैट इज डॉर्सिफ्लेक्शन. समझ में आया? स्टैंडिंग ऑन द टिप ऑफ योर टोज, दैट इज प्लांटाफ्लेक्शन. ये पनिशमेंट हुआ करता था जब हम बच्चे थे. when we were children, when we were small school going students, ये स्कूल में पनिशमेंट होता था. स्टैंड ऑन द टिप ऑफ योर टोज when the foot is plantarflexed. कौन से मसल्स कॉन्ट्रैक्ट करता है? काफ मसल्स कॉन्ट्रैक्ट करते हैं. बहुत ज्यादा दर्द होता है काफ में. टीचर इज वेरी हैप्पी. तो यू कैंट वॉक, चलना नहीं होता है बिकॉज काफ इज पेनिंग बैडली. So this is plantarflexion. And tell me now, which compartment does plantarflexion at the ankle joint? वैसे लेग के 3 कंपार्टमेंट्स हैं. हाँ, वैसे लेग के बच्चे, लेग के 3 कंपार्टमेंट्स हैं. Just remember this, लेग के 3 कंपार्टमेंट्स हैं. One is the posterior compartment, one is the anterior compartment, and one is the lateral compartment. 3 कंपार्टमेंट्स हैं. Posterior compartment does plantarflexion, anterior compartment does dorsiflexion, and dorsiflexion and inversion, and lateral compartment करता है eversion. eversion. हाँ, ठीक है ना. अब posterior compartment की nerve बोलो, tibial nerve. anterior compartment की nerve is deep peroneal nerve, and lateral compartment की superficial peroneal nerve. ठीक है. So if the deep peroneal nerve is damaged, you get a foot drop. You get a foot drop. ठीक है. Common peroneal nerve damage, you get a foot drop. बस ये एक just remember this table. तो ये टेबल से बहुत फायदा होगा आपको. What is the artery in this compartment? That's a posterior tibial artery. posterior compartment की artery, posterior tibial artery. anterior compartment के artery है anterior tibial artery, anterior tibial artery, and lateral compartment के artery है peroneal artery. peroneal artery, बस ये याद रखना. ठीक है, that's very important. So artery of the lateral compartment, peroneal artery. The nerve of the lateral compartment is the superficial peroneal nerve. Anterior compartment के artery है anterior tibial artery. The nerve is the deep peroneal nerve, and the posterior compartment के artery है posterior tibial artery, and the nerve is tibial nerve. याद रखिए. Just remember this. ऐसे ना फ्लो चार्ट्स बनाइए बच्चों. It's very easy to remember. चलो, we go to the next MCQ. Identify the muscle related to the marked structure. बोल सकते हो? Can anyone answer this? Muscle related to the marked structure. ये कौन सा bone है बोलो? What is this bone? That's a cuboid. ये bone है cuboid bone. And there's a groove below the cuboid. What is this groove? ये कौन से muscle के लिए है? The groove below the cuboid is for peroneus longus. ये याद रखना. That's for the peroneus longus. So peroneus longus grooves the cuboid bone. हाँ, ये बहुत important visual है. So the groove below the cuboid is for peroneus longus. Tell me the chief muscle inserted on the navicular tuberosity. बोल सकते हो? यह है navicular tuberosity. The chief muscle inserted is tibialis posterior. Tibialis posterior. Chief muscle inserted on navicular tuberosity is tibialis posterior. वो bone है cuboid. The muscle growing the cuboid, वो है ना muscle, ये ऐसे आता है and gets attached here. So that's the peroneus longus. Peroneus longus muscle comes from the lateral side. It grooves the cuboid, goes below the metatarsal bones, inserts on the lateral aspect of base of the first metatarsal and the medial cuneiform. बस ये याद रखना. Grooves and chief insertion on navicular tuberosity is tibialis posterior. 42nd. Which layer of the sole does the marked muscle belong to? बोल सकते हो? Layers of the sole पता है आपको? If you want, you tell me. Otherwise, you tell me what is this muscle? ये muscle कौन है? Flexor hallucis longus. ये muscle है flexor digitorum longus. These are the lumbricals, and this is the flexor digitorum accessorius. All these muscles belongs to which layer of the sole? बोल सकते हो? Flexor hallucis longus, flexor digitorum longus, the lumbricals, ये सब lumbricals है. These are all lumbricals. And the flexor digitorum accessorius. All these muscles belongs to which layer of the sole? Any guesses? Guess कर सकते हो? Any guesses? हाँ, okay, बोलता हूँ. बोलता हूँ. वैसे ना leg sole of the foot has got 4 layers. If this is the great toe, ये great toe है, and that's a little finger, great toe and little finger. So there are 4 layers of the sole. 4 layers of sole. Out of this, the first and the third layer are said to be intrinsic. Intrinsic layer मतलब they are in the sole. वो sole में ही होते हैं. हाँ, they are in the sole. हाँ, एक मिनट, गलत है, वो गलत है. I'll tell you. Just wait. हाँ, मतलब बस ये this, just remember this slide. That's very easy. The first and the third layer are known as intrinsic muscles. Intrinsic muscles का मतलब they will remain in the sole. वो sole में ही होते हैं. So how do you remember this? Put an abductor here. हाँ, abductor. इसका नाम क्या है? Abductor hallucis brevis. छोटा muscle है. Intrinsic muscle brevis. इसका नाम है abductor digiti minimi brevis. Abductor hallucis brevis, abductor digiti minimi brevis. बीच में है flexor digitorum brevis. ठीक है. abductor hallucis brevis फर्स्ट लेयर है. ये फर्स्ट लेयर है. छोटा छोटा मसल है. abductor hallucis brevis, abductor digiti minimi brevis, and बीच में है flexor digitorum brevis. फर्स्ट लेयर. वैसे ही थर्ड लेयर में आना. थर्ड लेयर में टेक फ्लेक्सस ऑन बोथ द साइड्स. फ्लेक्सस को दोनों साइड्स पे ले लो. फ्लेक्सर hallucis brevis, फ्लेक्सर digiti minimi brevis, एंड बीच में होता है adductor hallucis. adductor hallucis. समझ में आ रहा है? So third layer is like this. Third layer, first layer, third layer, सब छोटे छोटे muscles होते हैं. So brevis, छोटे muscles, they are named as brevis. So first layer में कौन है? abductor hallucis brevis, abductor digiti minimi brevis, flexor digitorum brevis. हाँ. Third layer में कौन है? flexor hallucis brevis, flexor digiti minimi brevis, बीच में है adductor hallucis. ये third layer हो गया. Come to the second layer. Second layer में होता है flexor hallucis longus, flexor digitorum longus, lumbricals, and flexor digitorum accessorius. Flexor digitorum accessorius. ठीक है. So flexor hallucis longus, flexor digitorum longus, lumbricals, and flexor digitorum accessorius. And the last layer has tibialis posterior, peroneus longus, and intraossei. बस, that's it. बस ये टेबल याद रखना. That's it. Clear? So just remember this. This is the layer of the sole. इससे easy और कहीं नहीं मिलेगा. This is my patent. That's my way. So that's the layer of sole. ठीक है बच्चों. tibialis posterior, peroneus longus, and intraossei. ये हो गए layers of the sole. ये चौथा layer, third layer, second layer, first layer. अब ये स्लाइड देखना, तो ये मैं बोल रहा था आपको, फ्लेक्सर हालुसिस लॉन्गस ये है, फ्लेक्सर डिस्ट्रम लॉन्गस ये है, ये लंब्राइकल्स देख रहे हो, ये फ्लेक्सर डिस्ट्रम एक्सेसोरीज देख रहे हो, so that's a second layer. Perfect. ठीक है बच्चों, ओके, हैप्पी हैप्पी हैप्पी, स्वाति फाइन है, अंकित ओके, वेरी गुड, चलो ग्रेट. हाँ, सो दिस इज द इजीएस्ट वे टू रिमेंबर द लेयर्स ऑफ द सोल. एक बार जस्ट रिमेंबर दिस, एवरीथिंग इज इजी. कम ऑन, कमिंग टू द नेक्स्ट एमसीक्यू. आइडेंटिफाई द पॉइंटेड स्ट्रक्चर. बोल सकते हो, ये बहुत ज्यादा इंपॉर्टेंट है. द स्ट्रक्चर विच वाइंड्स अराउंड द मीडियल मैलुलस. ये है अपना मीडियल एस्पेक्ट, मीडियल एस्पेक्ट है. ये है फ्लेक्सर रेटिनाकुलम, ये है टार्सल टनल. जैसे ये कार्पल टनल था, यहाँ पे कार्पल टनल, वैसे दैट्स अ tarsal tunnel. That's a tarsal tunnel, and these are the structures passing through the tarsal tunnel. Now you tell me, what is this structure? ये बहुत important MCQ है. The structure which winds around the medial malleolus. Look at this structure. ये क्या करता है? It winds around the medial malleolus. This is tibialis posterior. याद रखना, this is extremely important. The structure which hooks around the medial malleolus. That's a very important visual slide for you. The structure which winds around the medial malleolus is tibialis posterior, and the structure which winds around the यहाँ पे लिखता हूँ, structure winding around medial malleolus is tibialis posterior, and lateral malleolus is peroneus brevis. So structure which winds around the lateral malleolus. अगर बच्चों lateral malleolus दिखा and you see a similar tendon winding around the lateral malleolus, that's peroneus brevis for sure. Remember that. And the structure which winds around the medial malleolus is tibialis posterior. पहले medial and lateral समझना है. That is very important. ये medial है कि lateral है. To understand that is very important. ठीक है? So answer is tibialis posterior. Perfect. You're answering very well. बहुत अच्छा आंसर कर रहे हो बच्चों. The following abnormality is due to one of the following conditions. पहले ये abnormality बोलो क्या है? What is this abnormality? See, there's a big mass in the region of the sacrum and coccyx. बोल सकते हो? There's a big tumor in the region of the sacrum and coccyx. हम इसे बोलेंगे the sacrococcygeal teratoma. Sacrococcygeal teratoma. बोल सकते हो? Persistence of primitive streak. Yes, that's the persistence of primitive streak. So sacrococcygeal teratoma is due to persistence of primitive streak. Non-fusion of caudal neuropore बोल सकते हो? Non-fusion of caudal neuropore, इससे क्या होता है? Spina bifida. Non-fusion of cranial neuropore, that is anencephaly. So cranial neuropore fuse नहीं हुआ तो anencephaly, caudal neuropore fuse नहीं हुआ तो spina bifida, primitive streak persistent रहा तो what is that? Sacrococcygeal teratoma. Sacrococcygeal teratoma, fine. Neuroenteric canal छोटे टाइम के लिए, then it disappears off. Vital and duct persistent रहा तो fecal fistula. If it remains persistent, that's fecal fistula. If neuroenteric canal remains persistent, there's a communication between the spinal cord and the GIT. Neuroenteric canal, if it remains persistent, there's a communication between spinal cord and the GIT. There's a communication between the spinal cord and the GIT. मतलब CNS and GIT. ऐसे समझो उसको, CNS and GIT. हाँ, so just remember this. Non-fusion of cranial neuropores, caudal neuropores, spina bifida. Non-fusion of cranial neuropores, anencephaly. हाँ, ठीक है, बाकी सब ठीक है ना? Neuro is CNS. Enteric is GIT. One of the following is not a derivative of neural crest cells. बोल सकते हो? This is easy. न्यूरल क्रेस्ट सेल्स. कम ऑन बच्चों, आंसर दिस. दिस यू शुड नो. हाँ, ये बहुत इंपॉर्टेंट है. आई मीन दिस यू मे बी नोइंग, आपको पता भी होगा ये. एनी गेसेस, एनी गेसेस, एनी गेसेस? Come on, students, come on. Last 3-4 MCQs are left now. Come on, be quick. Answer. One of the following is not a derivative of neural crest cells. क्या होगा इसका आंसर? हाँ बच्चों, क्या होगा इसका आंसर? Answer this. This is very important. So adrenal cortex. Adrenal cortex is derived from mesoderm. It's mesodermal in origin. Adrenal cortex is mesodermal. AV cushion, Schwann cell, melanocytes. फिर इससे और क्या बनता है? ओडेंटोब्लास्ट. ऑडेंटोब्लास्ट बनते हैं. फिर एवी कुशन लिखा है, मेलानोसाइट्स लिखा है, श्वान सेल बनते हैं, श्वान सेल भी लिखा है. कॉर्नियल स्ट्रोमा, कॉर्नियल स्ट्रोमा और डॉर्सलूट गैंग्लियन, सिंपैथेटिक गैंग्लियन, ऑटोनोमिक गैंग्लियन. बोलो डॉर्सलूट गैंग्लियन, ऑटोनोमिक गैंग्लियन. एंड देन और क्या है? पैराफॉलिकुलर सी सेल्स ऑफ थायराइड. पैराफॉलिकुलर सी सेल्स ऑफ थायराइड, याद रखना. पैराफॉलिकुलर सी सेल्स ऑफ थायराइड. क्या लिखा है बच्चे? ए है ना. क्वेश्चन मार्क क्यों डाला है? यू बी कॉन्फिडेंट, बी कॉन्फिडेंट बच्चा. एड्रिनल कॉर्टेक्स, एड्रिनल मेड्यूला इज डिराइव्ड फ्रॉम, एड्रिनल मेड्यूला इज डिराइव्ड फ्रॉम न्यूरल क्रेस्ट सेल्स, है ना. एड्रिनल मेड्यूला इज डिराइव्ड फ्रॉम न्यूरल क्रेस्ट सेल्स. और उससे एवी कुशन बनता है, श्वान सेल बनता है, मेलानोसाइट्स बनता है, ओडेंटोब्लास्ट इज द टीथ फॉर्मिंग सेल, कॉर्नियल स्ट्रोमा, endocardial cushions of the heart, dorsal ganglion, autonomic ganglion, parafollicular C cells of thyroid. All this is derived from neural crest cells. Fine. Okay, a child lacks thymus and inferior parathyroid glands. Defective development of which one of the following structures is likely to be the cause? Answer this. Thymus and inferior parathyroids. Yes. This is very important. तो फर्स्ट से क्या बनता है? फर्स्ट से बनता है ऑडिटरी ट्यूब. फर्स्ट एंडोडर्मल पाउच से बनता है ऑडिटरी ट्यूब. सेकंड से बनता है पैलेटाइन टॉन्सिल. थर्ड से बनता है थाइमस एंड इंफीरियर पैराथायरॉइड्स. फोर्थ से बनता है सुपीरियर पैराथायरॉइड्स एंड अल्टीमो ब्रैंकियल बॉडी. अल्टीमो ब्रैंकियल बॉडी. डी जॉर्जिस सिंड्रोम फर्स्ट है ना, वो फर्स्ट का है डी जॉर्जिस सिंड्रोम. सो आंसर इज सी फॉर दिस. सी. So endodermal pouches, the first forms the eustachian tube and the middle ear cavity. Eustachian tube and middle ear cavity is derived from first, second forms of palatine tonsil, third से बनता है thymus and inferior parathyroids, fourth and sixth fuse हो जाते हैं, they forms the superior parathyroid and the ultimobranchial body. Fine. Okay, coming to the next, identify the type of cartilage. चलो बच्चों, ये भी बहुत बार पूछते हैं, कार्टिलेज के बारे में बहुत बार पूछते हैं. व्हाट डू यू थिंक इज दिस? व्हाट डू यू थिंक इज दिस कार्टिलेज? ये क्या कार्टिलेज लग रहा है आपको? कम ऑन कम ऑन कम ऑन बच्चों. यू सी पेरिकॉन्ड्रियम. ये क्या दिखता है? पेरिकॉन्ड्रियम. यू सी कॉन्ड्रोसाइट्स. कॉन्ड्रोसाइट्स एंड द कॉन्ड्रोसाइट्स आर द लार्ज इन साइज. लार्ज, बहुत बड़े बड़े कॉन्ड्रोसाइट्स होते हैं. एंड ये बीच बीच में क्या दिख रहे हैं? इलास्टिक फाइबर्स. इलास्टिक फाइबर्स दिख रहे हैं. सो दिस इज इलास्टिक कार्टिलेज. दिस इज इलास्टिक कार्टिलेज. ये याद रखना. बिग कॉन्ड्रोसाइट्स, बड़े बड़े कॉन्ड्रोसाइट्स दिखते हैं. हाइलिन कार्टिलेज में कॉन्ड्रोसाइट्स आर इन अ ग्रुप. ऐसे ऐसे ग्रुप में होते हैं कॉन्ड्रोसाइट्स. दिस इज नोन एज सेल नेस्ट. सेल नेस्ट. सो सेल नेस्ट इज एन कैरेक्टरिस्टिक ऑफ हाइलीन कार्टिलेज, ये याद रखना, सेल नेस्ट इज अ कैरेक्टरिस्टिक ऑफ हाइलीन। ये कहां पे मिलेगा? हाइलीन कार्टिलेज में। हाइलीन कार्टिलेज में क्या मिलता है? सेल नेस्ट। एंड मैट्रिक्स इज अमॉर्फस, अमॉर्फस मैट्रिक्स। व्हाइट फाइब्रो कार्टिलेज में यू गेट द स्मॉलेस्ट साइज ऑफ कॉन्ड्रोसाइट्स, मतलब सबसे बड़े कॉन्ड्रोसाइट्स इलास्टिक कार्टिलेज में, सबसे छोटे कॉन्ड्रोसाइट्स एंड व्हाइट फाइब्रो कार्टिलेज, याद रखना। स्मॉलेस्ट साइज ऑफ कॉन्ड्रोसाइट्स आर फाउंड इन व्हाइट फाइब्रो कार्टिलेज, लार्जेस्ट साइज ऑफ कॉन्ड्रोसाइट्स आर फाउंड इन इलास्टिक कार्टिलेज। Example of elastic cartilage, pinna, epiglottis. Thyroid, example of hyaline cartilage, thyroid, cricoid. Example of white fibrocartilage, pubic symphysis, menisci, articular disc. ठीक है? Easy. Which type of joint is present at the arrow mark structure? बोल सकते हो बच्चों? What is this? This is the pubic symphysis. हाँ. Pubic symphysis is what is the type of joint? It's the secondary cartilaginous joint. Pubic symphysis is secondary cartilaginous joint. Primary cartilaginous joint is the joint between epiphysis and diaphysis. The joint between epiphysis and diaphysis is the primary cartilaginous joint. ये fuse होता है, fuse. Primary cartilaginous joint is also known as synchondrosis. Synchondrosis. So primary cartilaginous joints का दूसरा नाम क्या है? Synchondrosis. And the fuse, ये fuse हो जाते हैं ना, the joint between the epiphysis and diaphysis, ये fuse हो जाते हैं. So that's a primary cartilaginous joint. Secondary cartilaginous joints are in the midline of the body. Midline में होता है intervertebral joints है, pubic symphysis है. So these are secondary cartilaginous joint. Fibrous joints, sutures, syndesmosis, gomphosis. तीन types के होते हैं fibrous joints, sutures, syndesmosis and gomphosis. बाकी synovial joints तो आपको पता है. ठीक है ना बच्चों? ये joints याद रखना, joints are important. एक तो सवाल आता ही है joints से. So primary cartilaginous joints का दूसरा नाम है synchondrosis. इसके examples याद रखना. Secondary cartilaginous joints are in the midline, वो याद रखना. Fibrous joints are of three types. Sutures, हाँ लिखो क्या? Sutures, that is found in the skull. Syndesmosis, that's interosseous membrane between the radius and ulna. And third is gomphosis, that's teeth fitting in the socket. Teeth fitting in the socket, that's peg and socket type of joint. Okay, see the last, coming to the last MCQ of the day, students. A special efforts specially done by the PW MedEd team for you all. Chalo, answer this last MCQ. Which of the following defects is responsible for this condition? बोल सकते हो, what is this clinical condition? Anencephaly. अभी मैंने बोला आपको anencephaly. देखो anencephaly यही है. So what is the answer for this? Anterior neuropore closure defect. Failure of closure of anterior neuropore is anencephaly. Posterior neuropore से क्या होगा? Spina bifida. Spina bifida, ठीक है ना? सा anterior cranial neuropore defect. हाँ, तो ऐसे visual slide होंगे which will be given to you, which you have to remember. I hope, thank you to all of you. Anencephaly, yes. I hope things are clear. Huh? Enjoyed. I hope you've all enjoyed the session. And ऐसे ही पढ़ो. You all have been answering really well. ऐसे ही put in efforts and do well. You'll definitely do well. So बाद में we'll meet for the recall session and we'll definitely meet for your interview. Okay. I hope this lecture is clear to all of you. Thank you so much from the entire team of PW MedEd. All the best to all of you. Do well. ठीक है. Thank you and good night. And all the best. Anencephaly, entire thing is open. That's anencephaly. Prosencephaly, yes, anyone? बोल सकते हो? वो आगे का पार्ट होगा, प्रोसेंसेफ्लॉन, दैट्स ओनली एंटीरियर पार्ट. नर्व कॉलम्स याद करा दो. नर्व कॉलम्स में बच्चों एक है ना, वो ये याद रखना, स्पाइनोथैलेमिक ट्रैक्ट याद रखना, दूसरा ट्रैक्ट फाइन सेंसेशंस, क्रूड सेंसेशंस एंड फाइन सेंसेशंस का ट्रैक्ट ऑफ गॉल एंड बर्डा याद रखना, क्रूड सेंसेशंस का स्पाइनोथैलेमिक याद रखना, फर्स्ट ऑर्डर, सेकंड ऑर्डर, थर्ड ऑर्डर न्यूरॉन याद रखना उसमें, एंड कॉर्टिको स्पाइनल ट्रैक्स याद रखना, डिसेंडिंग में कॉर्टिको स्पाइनल ट्रैक्स याद रखना. ठीक है, ओके. आई होप दिस इज क्लियर टू ऑल ऑफ यू. ठीक है ना आशुतोष, फाइन है. Thank you so much to all of you. Thank you so much and all the very best. All the very best. Okay, I'll stop here.